Pat Tillman, will you do us the honor?
No, I'm good.
We've had a tragic year and have lost students throughout the year. And tonight we want to remember each and one of those students that are no longer with us. We will begin tonight's meeting by remembering students who passed away from November 2019 and September 2020. Although we celebrate their lives and the positive impact they made on GCS family, our hearts are extended in grief to their loved ones. On behalf of the Board of Education, we'd like to extend our deepest condolences to families, friends, and teachers of these students. Board members will help read the names of these students, and we will finish with a moment of silence. Angela?
Angel Hendren, Haynes Inman, Education Center. Shamiran Thomas, Andrews High School. Shaquana Delaney, Ragsdale High School.
Camp Rush, EC Pre-Kindergarten.
Yvonne Johnson Rumley, Eastern High. Maurice Williams, Eastern High. Justin Porter, Eastern High.
Sincere Graves, Smith High School.
Abdullah Mohammed, Oakview Elementary. Leila Ayinko, Oakview Elementary.
My heart and prayers are with the family of Autumn Jones from Hairston Middle, Mackenzie McKinney, Simpkins Elementary, Nicholas Gillespie, Gateway Education Center, Jordan Anderson Moore, Gateway Education Center, and Joshua Butler, Rankin Elementary, and all the other children.
Northern High School, our hearts and prayers go out to the family of
High Point Central, Tony Prince.
Although we were only privileged to know these students for a brief moment of time, in their own ways, they helped to create heartwarming memories that would be cherished forever. To honor these students, please join me in a moment of silence. Thank you. Please remember to talk directly into the mic to assure that everyone can hear you. A reminder that public comments are sent in to the Board of Ed at gcs.com. We have read, many of us board members have read so many comments and totally understand the concerns of our teachers as well as our parents, and that we are dealing with a very difficult time. But be assured that we are reading those comments with heavy hearts for everyone.
Question, Madam Vice Chair. A point of privilege. We could do a, everything that's happening in the pandemic, a thinking of you or an acknowledgement, those, our teachers and staff that are battling COVID, as well as the family members they have lost and that are currently battling COVID. I have cases in my district, we all do, in various capacities, but to acknowledge that we're thinking of them while they are dealing with death as well as, fighting to survive. Just want to do a thinking of you acknowledgement to those staff that, that came out.
Thinking of everyone that has been impacted by COVID, no matter who you are. It is a challenging situation for all of us. We are now at approval of the agenda.
The agenda.
Second.
I wasn't planning on being the leader of this meeting, so I'm kind of in a predicament because I would like to take from the table the item that was pulled back on September the 24th and have it added to the agenda for discussion. Board lawyer, do I need a motion to? Right, I would like, well, I don't know that I can do it, so. Board, can I make the motion? I move to amend the agenda to add the table item as of September the 24th for discussion. We will take a vote. Do I need to call it for each member?
Any other way.
Okay. Mr. Tillman?
Yes.
Ms. Sharp? Ms. Garrett?
Yes.
A point of clarification, Madam Chair. Your amendment, is that on the consent agenda or is that on an item for discussion?
We'll add it to the agenda for discussion.
Okay, and not adding to consent?
Oh.
Okay, thank you for clarifying.
Mr. Gladden?
Aye.
Ms. Irby? Could you speak into the mic?
I said no.
Ms. McGregor?
No.
Okay. Myself, yes. Oh, Diane Bellamy? No. No. Okay. Passes 5-3. We passed the consent agenda, I believe. I mean, we passed the agenda. Now we need to pass the consent agenda.
Move.
Second.
Madam Chair, could we pull item C?
I didn't hear Diane.
Madam Chair, could we pull item C?
All right, we will be pulling item C. So we will be approving item A, B, D, and E, and the superintendent will read that at this time. And F. Thank you.
Good evening, Madam Vice Chair, members of the board. This evening's consent agenda includes several items. Those items are approval of the meeting minutes from September 24th and October 13th, the personnel report, the City of Greensboro proposal regarding permanent sidewalk easement, right-of-way dedication and temporary construction easement, the contract between the Guilford County Department of Health and Human Services and the Guilford County, the provision of nomination.
Move approval of
This evening's consent.
the consent.
I will take a vote. Mr. Tillman?
Yes.
Ms. Sharp? And please, you have to pull your mics all the way up, please. They're telling me that we're going in and out. So everyone, please pull your mics all the way to you.
Aye.
Ms. Garrett?
Yes.
Mr. Glad? Ms. Irby?
Yes.
Ms. McGregor?
Yes.
Ms. Bellamy Small?
Yes.
Believe that passes unanimously. Ms. Bellamy Small, do you want to go back to item C?
Thank you. I just need clarification about how does this impact, or if it has any impact on ACEs, or are these going to be two separate programs? Because clarification of
Yes, even though this grant could be used for childcare, the application we will submit is for tutoring for students.
Okay, but it's child care. Okay, so you're from what I read was that you intend to use this strictly for support services for remote learning.
It's to support students during remote learning. Even though the name of the grant includes the words childcare, we're not using it for childcare, we're using it for tutoring.
There's two legs of that grant, one for childcare and one for support services for online learning. So there's two legs of that grant.
Thank you.
Thank you.
Motion to approve.
Gladden, you have a question?
Yes, as it relates to the tutoring, would that be tutoring at on-site at GCS locations or in the spaces we have rented for overflow to accommodate the social distancing guidelines?
Overflow?
For the tutoring, if we're approved for the grant and we receive it, would those be for tutoring that are at GCS buildings, on site for GCS buildings, and not the additional places we procured because of the new class size mandate for COVID?
This is for remote tutoring.
Because this will be online virtual remote tutoring?
Yes.
Thank you.
Okay. I believe we had Ms. Irby,
Okay.
all right, Mr. Gladden seconding. All right, here we'll vote. Mr. Tillman?
Yes.
Ms. Sharp?
Aye.
Ms. Garrett?
Yes.
Mr. Gladden?
Yes.
Ms. Irby?
Yes.
Ms. McGregor?
Yes.
Ms. Diane Bellamy Small?
Yes, as a clarification, I had moved the item whenever I finished my question. So, but yes.
Okay, and Linda Wellborn? Yes. So Diane, if you have a question, you can ask that now.
No, what I was telling you was that I had moved the item when I finished my questioning.
Sorry.
After I brought the question up. So
Promotion.
my vote is yes.
Okay.
I just wanted to clarify for Mr. Gladden, we have not rented any spaces for social distancing or overflow, just for the public. Thank you.
Are at reports from the chair, or comments from the chair. Thank you to everyone who voted in last week's election. We are very pleased to see that the citizens of Guilford County chose to support the district by passing the $300 million bond referendum, the first in 12 years. This is an exciting step forward for Guilford County Schools, and we appreciate the support of our community, and we begin the process of improving and updating our aging buildings. College Kickoff Series will wrap up with its final event on Thursday, November the 12th, from 6 to 7 p.m. This final session will walk through the FAFSA process step by step. Learn more and sign up for these free webinars at sayyesguilford.org/fallcolleges Fall College Series. We may want to put that on our website, okay? GCS has announced its 2021 graduation schedule, which is subject to a review of public health metrics. If in-person graduations are held, they will begin on May 26 and end on June 6 for 31 schools. Please go to our website at www.gcsnc.com for the full schedule. GCS Arts is expanding its professional development opportunities for teachers, students with special needs in integrating the arts. This program is funded by a generous partnership with the Kennedy Center. GCS Arts will be partnering with GCS Media Services to use the arts in helping improve literacy skills. In addition, GCS Arts was featured in the School CEO magazine this quarter for its success in becoming a national leader in public school arts education. The magazine detailed the tremendous growth of GCS Arts and the fantastic support from Superintendent Dr. Contreras and the GCS Board of Education. I will say, I see all the artwork that is displayed in our lobby, and it's changed out on a continuous basis, and often I walk through there and I'm totally amazed at the beautiful work and the skills of some of our students. It is amazing. November is National Family Engagement Month, and Guilford Parent Academy is celebrating all month long. Families are invited to join virtual events, participate in fun family activities, and learn more about the importance of family engagement. You can learn more on our website. We'll also celebrate American Education Week, which is November the 16th through the 20th. This annual event, sponsored by the National Education Association, is an opportunity to thank our public school educators, support professionals, parents, and substitute teachers. Please join us by expressing your appreciation on social media with the hashtag #AEW2020. This time, we would like to take a quick break to honor our outgoing board members, Darlene Garrett and Byron Gladden. Byron has been a member of the board for 4 years, and Darlene has been on the board for 20 years. It will not be the same without them, and I do truly agree with that. I will miss you both. During their years on the board, Darlene and Byron have been tireless advocates, both for the students and staff in their districts, and for Guilford County Schools and public education as a whole. We are grateful to them for their service, and we wish them the very best. To thank them for their dedication to our district, we have given them each a personalized token of appreciation. Gifts will be at the board member seats. Well, you have your gifts already.
Thank you.
So, I have some copies of your appreciations. So it says, Guilford County Schools soar to greatness in appreciation of 20 years of service. Guilford County Board of Education, 2000 to 2020. Darlene Garrett, thank you for your commitment, contributions, and service to Guilford County Schools. Presented on November the 10th, 2020. I must say, you have been a dear friend and an advocate for children way beyond so many. You are always willing to fight for our children and our students and our teachers, so I do appreciate it. Guilford County Schools soar to greatness in appreciation, 4 years of service, Guilford County Board of Education, 2016-2020, Byron Gladden. Thank you for your commitment and contribution and service to Guilford County Schools, presented November 10th, 2020. Byron, you are always passionate you are always dedicated to your community, and you are always sometimes entertaining. But we love you.
Sometimes.
If there's any other board members that would like to make any comments, please feel free to do so. That's all right. We're at a good transition point, if you're ready.
Thank you very much. I'm sorry I'm late, but, thank you, Dr. I would like to, Darlene and I talk about us often, because I think you've been here the whole time uninterrupted that I've been here. 18 years, long time, on a journey. I met Michael, and it's been a relationship I haven't appreciated without you. Thank you for your passionate advocacy of programs. Byron, I was with you when this started, and often think about our beginning when I met you at a city council meeting. Journey for 4 years. I appreciate you have built leadership for yourself and people that you're serving in the schools in your district and our overall community. And so we're going to have a reception after the meeting, or after the meeting in the board members.
Just like to say, Darlene, one here that will miss you more than me.
Oh, thank you.
We spent a lot of years together, a lot of hard years, different years. Yeoman's job, unity, and and at times extremely interesting, but I know your heart is in the right place.
Thank you. That was genuine, Anita. Thank you.
I just want to thank both Darlene and Mr. Gladden for serving the people. It takes a lot to do this. People think that we just show up when the cameras are on, but it takes a lot of work behind the scenes to hear on to staff and the public that we serve. So I know that for Darlene, you know, if you've been in this for 20 years, that's a lifetime. You know, I've served in 2 those times that felt like a lifetime. But thank you for Mr. Gladden. I want to thank you for helping us to try to stay on track and do what is right for the children of Guilford County.
I was going to save my comments for the board comments at the end, but I'll do that now. And when I first ran for District 3, you know, Darlene Garrett, the standard in the Northwest area is, I thought if I could just ever get close to that, you know, it was always, what does Darlene think? And you need to talk to her. So thank you for your leadership and setting the standard and the bar so high, particularly in much of District 3. And Byron, we've disagreed on plenty, but we've always, I think, remained friends, and I sure hope that will continue. And you've got a lot of potential, and I'm sure you've heard that before. And just fair winds and following seas, and I'm just a phone call away if you ever need anything at all. Thank you both.
Thank you, Linda, for your facilitation and precedence over the board meeting. Dr. Contreras, we're now at comments from the superintendent.
Thank you. Evening again. Tomorrow is Veterans Day, and I'd like to thank all those who have served our country as a member of the military, including our very own board member, Patrick Tillman, who served many years as a member of the Marine Corps. Our veterans are essential to protecting the freedoms we enjoy in this country, and we honor them not just tomorrow, but every single day. I was so encouraged to see the results of the bond referendum, which will provide $300 million to renovate and rebuild schools that are in the worst condition. This is the start of a long process to give our students and staff facilities that will meet the needs of education today and for years to come. We are grateful to the principals, teachers, staff, board members, and community members who helped share information about our schools over the last few weeks and ensured their school communities and Guilford County residents knew the school bonds and quarter-cent sales tax were on the ballot. While we worked hard to educate and inform voters about the importance of the quarter-cent sales tax as a funding mechanism for the bonds, we were not successful. We will continue to engage our communities as the Board of Education develops a path forward with our colleagues on the Board of the County Commissioners. Next week is Hunger and Homelessness Awareness Week, an important reminder that many of our families struggle with food insecurity or a lack of permanent housing. In 2019-20, more than 2,100 GCS students experienced homelessness, and our district poverty rate is more than 66%. Please take the time to next week give back to these causes through a donation or volunteer effort, and say thank you to the many organizations that help our students with food and housing needs. And as we approach the Thanksgiving holiday, I encourage you to take time to reflect and count all the things we can still, in the midst of a pandemic, be grateful for, both physical and spiritual. This year has been full of challenges and frustrations, but we are here today together. As a reminder, Guilford County Schools will close its schools and offices between November 25th and December 4th as a preventative measure. Students will learn remotely during the week of November 30th through December 4th, and staff will work from home. Please continue to practice the 3 W's and limit contact with those who are not in your immediate family. I wish you a joyous Thanksgiving holiday filled with the spirit of giving. This concludes my remarks.
Dr. Contreras, we are now at action items, our update on COVID-19 metrics.
Thank you, Chairperson Hayes. This evening, I plan to discuss 2 key recommendations with you. The first recommendation centers on using an expanded set of metrics when determining when to return more of our students to school, decision-making metrics. The second recommendation, based on the expanded metrics we are recommending, focuses on restarting our plan to gradually return more students to school for in-person instruction. Joining me this evening are Dr. Carr, Chief of Staff, Dr. Keisha Osai-Sarfo, Chief Performance Officer, along with our colleagues and partners from Guilford County, including Dr. Yulia Van, Director of Guilford County Division of Public Health, and Don Campbell, Director of Guilford County Emergency Management. The community health metrics and mitigation strategies approved earlier this fall by the school board were designed to help drive the district's decision-making process regarding the reopening of schools. Our goal tonight is to gain clarity on the board metrics and to propose an expansion of the metrics to include additional studies and relevant data regarding the impact of COVID-19 school closures and remote learning on our students' academic learning, as well as their social and emotional well-being. We also plan to share information regarding the emerging science and data regarding the impact of school reopenings on student and staff health and community spread of COVID-19. I'd like to ask Dr. Nora Carr, Chief of Staff, to start us off this evening.
We have engaged in multiple discussions with our local public health officials about our community health metrics and have participated in multiple webinars that have been sponsored and presented by the ABC Science Collaborative, which you'll recall is part of the Duke University School of Medicine. I'd also like to introduce in the back Heather Skeens, who's new to public health, relatively new. She's the director of the Guilford County Department of Health and Human Services, if you don't mind waving. There you go, great, thank you. Based on these discussions and the participation in the ABC Science Collaborative, a couple of things are becoming clear to the scientists studying COVID-19, and one of those is that schools are not becoming the epicenters of community spread as originally feared. When schools were shut down last spring, certainly that was done in an abundance of caution. We are dealing with the novel, AKA new, COVID-19 virus, and while there's still much to be learned about the virus, more and more studies are coming out indicating that particularly at the elementary school level, students are less likely to spread COVID-19 to each other or to the adults in the school. And in general, schools are opening in a way that is not having an outsized impact on community spread. In fact, as more schools reopen or remain open, even in areas with significant surges in community spread, the data suggests that when mitigation protocols are adhered to, such as social distancing, hand washing, additional cleaning and disinfecting, and the wearing of face coverings, the transmissions of COVID from student to student and from student to teachers or adults, as well as clusters, which we've learned this from our public health officials, means 5 or more cases that are epidemiologically linked, and I'm really excited I was able to say that really long word, in schools are minimal, and they're going to give you much more detail in just a minute. To update the board and the public on our current health metrics, as well as on the emerging science and data, regarding community spread in schools, we've asked Dr. Yulia Van, Director of the Guilford County Division of Public Health, to join us. Please note that Dr. Van and her colleagues only have 1 hour to spend with us this evening, and will need to leave shortly after they conclude the remarks and answer any questions that you may have. So with this, I'd like to turn the podium to Dr. Van, and I believe Lisa has her slides that she can speak from and show to the public as well. And they are on the screens for viewing in this room. Thank you, Dr. Van.
Thank you so much, Dr. Carr. Thank you, Madam Chair, and thank you, Board, for having me tonight to give you a brief update on the metrics. I will also discuss Guilford County COVID-19 specific data, and I will also discuss emerging research from public health professionals across the world around COVID-19. The first slide that you see here is focusing on a few data points. If you look to the right side of that slide, you will see some total numbers from the beginning of March, and going to the left side of the slide, it focuses on newer cases. So today, this data is for today, November the 10th. We have identified 102 new cases today. We have 113 hospitalizations in our healthcare systems related to COVID. Today, we also received notification of 1 additional death related to COVID, which brings our total number of deaths to 208. And we have 1,556 active cases. That means those are cases that are still that we're still working on, they're still in isolation, that we're still following up with. We are in that process of monitoring those cases. The next slide focuses on the first metric that the board approved for school reentry, which are the Harvard and the CDC numbers. These are the new cases the new cases of COVID-19 in our community. The first screenshot mentions the Harvard data. One thing that I wanted to mention here and focus your attention on is the fact that initially at the beginning of October, we were seeing Mondays as high numbers of cases that were being reported to us, which led to those days to be in the red category for transmission. However, starting the end of October towards the first week in November, we are seeing other days that are highlighted in red for the highest risk of transmission. One of the things that we've noticed is that people fell sick over the weekend. They've had symptoms or they were exposed during the weekend, and they would seek testing during those Mondays, which led for those cases to be identified on those Mondays. For everybody, I would like to remind everybody what these metrics are. The Harvard metrics focuses on the new cases that we are identifying on a specific day. However, the CDC metrics are a 14 rolling time frame. So we're moving into the CDC metric for new cases. Again, these are 14 days of cases that are being calculated, and we are looking at the fact that starting October 6th, we have been in a continuous red category, which is the highest risk for transmission in schools. Those numbers have been fluctuating during those weeks in red. Sometimes they are going over 285, sometimes they're going lower, 240, but in the last week, they have surpassed 300 per 100,000. Going into the next slide, we will focus on the positivity rate. And I know that this slide is a little bit harder to see the way that it is presented here because of the black and blue color there, but I wanted to bring your attention to the lower corner, which mentions the positivity rate for the last 14 days. That is, again, a rolling 14 days time frame. We are at 7.3% positivity right now. To give you a little bit of history in the last couple of months, starting with September, we've had several days in which that positivity rate had spiked. We have seen numbers as high as 11.1%, 11.2% in September. We have had days in October where it spiked to 15.5% on October 26th. And recently, from the beginning of November, that positivity rate has been slowly decreasing, spiking a little bit on a few days, but then staying pretty consistent, a little bit over 7%. And right now, we've had the lowest positivity rate on November 6th at 6.4%. If you go on our website, healthyguilford.com, we have the interactive dashboard that is allowing you to hover over each one of these data points and actually see every day the positivity rate on that continuum of tests, and also the tests that have been performed every day in our county, in our community, in partnership with all of the testing partners that we have here in Guilford County. Moving on to the next slide, I will talk about the hospitalizations that we're seeing in Guilford County. These are numbers that are unprecedented to our community. In the last 3 days, we have seen the highest numbers of hospitalizations here in Guilford County.
No question. Dr.
Absolutely.
Van, pause,
yes.
because the picture isn't stable and we don't have a copy of this presentation. Can it be emailed to us? Because I'm having difficulty focusing because it's doing this.
I assume that shouldn't be a problem.
Okay, yeah, we can be sent so I can follow here because I can't. It's bothering me. Thank you. You can proceed.
So for the last 3 days, I was talking about the hospitalizations, and the last 3 days we've seen extremely high numbers in our hospitals. Today we have reported 113 community members that are hospitalized currently due to COVID-19. Yesterday we've had 102, and last Friday 99. So these are the highest numbers that we have seen so far since we've started receiving these reports from our healthcare systems. This includes Cone Health and Wake Forest and High Point. So this concludes the first part of my presentation, which just gives you an update on where we are with the metrics that the board has approved. Some of them are moving in the wrong direction. Some of them are staying a little bit more stable in the last 2 weeks. However, we are concerned about these numbers just like we have been concerned about the numbers before. So I will stop right here if you have any questions about the metrics before I move into the next part of the presentation. So it won't be challenging to go back to these if you choose to do so. If you choose for me to go forward with the rest of the presentation, I can do that as well.
I have a question, Dina. I'm behind you, so you can't see.
And then Pat.
How did this data compare to some of our other counties, Forsyth, Wake? What are you seeing in those counties as you're talking to those medical directors and looking at their data?
Absolutely. So the data overall is very similar to the larger counties in North Carolina, is very similar to what we're seeing here in Guilford County. Just last week, I have made a presentation to our Board of Commissioners, and when it comes to total number of cases, we are on the 3rd place, just like we are on the 3rd place as far as the the 3rd largest county in North Carolina. So those cases are being proportionate to our counties, with Wake and Mecklenburg being on the 1st and the 2nd place. When it comes to the number of deaths, we're actually on the 4th place, with Orange County leading that numbers due to the high number of deaths that they have experienced in long-term care facilities. So to summarize my answer, we are very closely following a similar path in both cases, hospitalizations and deaths, with other large counties, peer counties in North Carolina.
Thank you.
Absolutely.
Thank you, Dr. Van. I'm just curious, and I imagine this could be a small number, but I don't know. If, let's say, someone is test positive in Randolph County, but then they end up going to Cone Health in our county, how does that work?
So the hospitalizations are based on the hospitals reporting that. They don't have to be necessarily Guilford County residents. However, all of our cases are very much county specific. So it is a possibility that Randolph, Rockingham, or any other surrounding counties are seeking care in Guilford County, and those beds are being attributed to COVID-19 cases. That particular metric truly shows the capacity of our healthcare system and how overloaded they are with cases from our entire area. So it is important to identify the fact that even for the school system conversation, we have parents and families that work in other counties, not only in Guilford County, and that impacts the way that the community spread happens. So it is a regional approach as well as a local approach.
And is there any data that you have that can be shared, maybe not tonight, but at some point, on recovery? Do we have recovery statistics on, those that are hospitalized and then recover?
Absolutely. If we can go back to the first slide, I would like to mention, or to bring attention to the lower left corner where it lists the recoveries. 10,954 individuals have recovered from COVID. This number excludes the active cases, and it also excludes the total deaths that we have experienced. So we have 10,954 individuals in our community that have recovered.
Thank you.
Absolutely.
Darlene, then Bob.
Dr. Van, would you say the numbers that we're experiencing here in Guilford County are high? It's a high prevalence of the virus?
The numbers that we are seeing are definitely going in the wrong direction right now in the number of new cases and the number of hospitalizations. The metrics that I've presented also includes the positivity rate, which is stabilizing a little bit. So that is one of the metrics that is showing a little bit of an improvement.
It's still over the 5%.
It's over the 5% for what the board has voted on, yes.
Okay, but I just want you to tell me, yes or no, do you consider this a high prevalence of the virus? Are these numbers indicating a high prevalence of the virus?
For the population that we have, we are seeing a lot of cases.
Okay, well, I'm sure you've heard of Dr. Vivek Murthy, the co-chair of President-elect Biden's task force on COVID. Dr. Murthy said the 3 keys to opening schools, number 1, which is critical, low community prevalence of the virus. With that?
I agree with what the chair of the task force said. Yes, I agree with that.
All right, Byron?
So I know we're talking about the rate of recovery and infection as it relates to children, and the data does show that children are, lowest to get it, and, one of the top groups that are showing recovery. Of course, there were incidences where children have passed. The concern for us as a county and as a school district is, of course, with children, particularly children that are medically fragile, getting the virus, but it is the adults who teach the children. This is not a district where children teach children. So when you have adults that teach children, and based on our dashboard, we had 24 positive cases of COVID concerning staff for the month of November. With all the mitigating strategies that we voted on and agreed, and the markers on the floor in most of the schools, PPE and et cetera in most of the schools, I haven't had information data to verify it's in all, but we're assuming that PPE and other things are being provided. We're still at 24 cases. So there's been a lot, and I watched the press conference today with Cooper about, adults need to practice mask wearing, social distancing, need to do all of that. And I feel that staff overall that are in these schools have done that. And we're seeing cases with just adults. And so adding the children to the component, because I'm looking at various research, there's a Princeton article about children based in India being particularly used to being a super spreader and taking that back home. We're looking at the pre-existing conditions of their families. Not that children will not recover from COVID, but their families will not recover from COVID, and the people who teach these children, if they are infected, will not recover. So can we speak to that in terms of the safety of our employees? Because the numbers are rising. And yes, even though our staff are back in schools largely and have been since August, we've had a minimum number of cases because we've been doing the right things. However, to open and add more children, and we don't know who's doing social distancing in and out habit, that puts us at risk. And with the cases and the hospital rates going up, could we not become a contributor to, an additional increase? So we're trying to figure out how to do this smart. And I'm looking for a way that's not about how, what children are going to do, what children are going to recover, but it's the adults that are getting the pop on the wrist for not social distancing, and we're still figuring out how this virus moves. So can you speak to that from adults in our school district, in our systems, on our buses, with children that may or may not be asymptomatic, and their risk level, and what does that mean for us as a district? Because we cannot teach children without teachers and bus drivers and custodians and staff and everyone else.
Well, I have a few data points that I would like to share with you, and I think this is a perfect time to do that. We have looked at the investigations that we have done since August 27th. When the school year started, we had 128 individuals that were placed in isolation, so that means they're positive COVID-19 cases. Out of these 128 cases, 111 were staff, teachers, adults, and only 17 of them were students. And out of these investigations, we have had 354 individuals that were placed in quarantine, 192 adults and 162 children. What I would like to bring attention to is the fact that there were only a couple of situations in which secondary transmission was recorded. That means the conversion of a close contact to a positive case, and these couple of cases were only identified in adults. No records of secondary transmission have been identified by our department between children, from children to children, or from adults to children. So we have only identified secondary transmission between adults and adults. So I think that this is something that I wanted to bring to the board so you can be aware of that. And as far as the adults are concerned, it is the same risk that is for all adults everywhere, not necessarily in schools, and using those prevention strategies is going to help mitigate the transmission and infection of COVID in schools as well. So I hope that that clarifies the question that you had. I don't think that there was a question, actually, but I hope that that answers.
The question was to center us on the adult rate of infection, which you did that. And then the follow-up is, what seems to be the trend is, if you have cases in a school district, it's not just adults that are being quarantined. We're quarantined in some places. You know, it's been advised to quarantine entire classrooms of children. So then you have an interruption in a process of learning and education. We're having to start, stop, which is going to be our norm until, you know, we have an effective vaccine. So I get that. You know, I get that piece, but I'm just speaking to, if everyone outside, you know, outside the school district as a state, we're having to, you know, decrease involvement, social distancing. You have major holidays coming up, and I was looking at the comments today. People are like, I'm not going to have Thanksgiving with my family. I have stayed indoors all year long. This also goes for staff. So mitigating strategies play a role, but you have just, humans are going to do what they're going to do. So how can we keep, you know, if it is the decision of the board to reopen, how can we keep our schools safe in addition to what we're doing now? Because we have to factor in the human element, because we're factoring mitigation strategies. So what are things that we can do that we're not already doing in the event that's the will of the board?
Well, I think that one of the things that the board could help is promote the 3 Ws for everybody in the community. Just like you said, the teachers are part of the community. They have families, and they're going and they're having gatherings for Thanksgiving, and that is probably going to be something that would be considered a high-risk situation. So if the board can continue to support the prevention strategies for all of our community, which includes the teachers and the staff, I think that that would definitely help put the schools on the right track.
And last question, do you think that it would be easier if we, you know, transition the, you know, additional grading process more so on a volunteer basis from adults, or do you think going back full with the proposed strategy would not have a severe impact in a negative way with the current numbers?
I'm sorry, I don't really understand the question.
We advise adults to come back voluntarily, we advise teachers to come back on a volunteer basis with the proposed schedule instead of the mandatory proposal of K through 2, for example.
I believe that recommendation is the superintendent's recommendation, not mine.
Okay, thank you.
Dr. Van, if I'm following you correctly, is a secondary transmission, when you say there's no secondary transmission, what exactly does that mean in layman's terms?
Oh, absolutely. Thank you for asking me that so I can clarify. So it means that if somebody let's take a classroom, and let's say we have a teacher in that classroom that was identified as a positive case. We have quarantined that classroom, those kids, and we have not seen any of those kids that have been quarantined as positive cases now after the end of the quarantine period. So that is a secondary transmission when a close contact of a positive case converts to a positive case themselves.
Okay, so if I followed your data right, so far of the numbers that you cited, none of them were traced back to a GCS school or facility yet, or were some? Any secondary transmission yet?
A couple of situations where we did see secondary transmission with another adult.
Okay.
Yes.
Okay.
Was that reported to the board, Dr. Carr?
Well, this is new information I'm just getting right now. That's why I'm asking a clarifying question.
Okay.
It was just one situation that we were able to backtrack that happened as part of the investigation. So
What happened?
we're doing, like I said, we've had 128 since August the 24th.
Right.
One situation of one positive case of secondary transmission, it is definitely not statistically relevant.
Thank you.
Anita, then Diane.
Nora just asked my question. Thank you.
Okay. Diane?
I got the answer.
Can we go back to page, I think it's 3? It's the one that's got the 2 sets of calendars. Okay, my question has to do with the one in the lower corner that has the 5 weeks of red. Is that Guilford County? That represents Guilford County, right?
That's correct.
Okay. Dr. Van, in your professional opinion, if we've had 5 weeks of red, do you think that it's likely that the next 2 weeks are going to go back to yellow, orange, or yellow?
Are we going to see yellow or orange rates in the next couple of weeks?
Yeah, based on what, I mean, if we've had 5 consecutive weeks of red, in your professional opinion, is it likely that the next 2 weeks are going to revert?
It is absolutely possible, but probably not.
That's going to put us with, that potentially will put us with 6 weeks of red going up to Thanksgiving, right?
That's correct.
Okay, and then if we add Thanksgiving in there, and if what we're saying is that it's likely that people are going to get together for Thanksgiving, then even if we see a decrease the week of Thanksgiving, it's possible that it could go back up that next week, even though we're doing remote. Right?
Well, I cannot foresee what's going to happen after the week of Thanksgiving. We are hoping that all of the messaging that we're putting out there and all of the information that we're sharing is going to really drive the community to do have all of those prevention measures in place, avoid gatherings as much as possible, travel as little as possible, wear masks, wash their hands, do social distance. So we're anticipating that people are going to have some type of family gatherings, but I cannot tell exactly how those numbers are going to be in 2 to 3 weeks from now, other than probably following a similar pattern.
Then I guess, didn't you present on the 24th? At that point, I think we.
Can you please repeat that? I'm sorry, I couldn't hear you.
I said when you presented to us on the 24th of September, is that correct? And at that point, Guilford County was in orange, right?
If I remember correctly, yes, but
okay.
yes.
And I think at that point, we tried to emphasize that it was important for us to get in orange or yellow more, that would be more desirable. And so if you look at these maps, we have not gone anywhere near what your recommendation to us was on the 24th of September. In fact, we have gone 5 consecutive weeks in the opposite direction. So I guess my concern is that I don't think that in the next 2 weeks we're going to go back down. And I think you have kind of confirmed that from in your professional opinion, correct?
That's correct.
Thank you.
Dr. Van, how much, when we look around the country, and we know that right now there are 24 of the top 50 districts, largest districts in the country that are going back to in-person learning. Denver, Atlanta, Dallas, San Diego, our neighbors in Greenville, South Carolina, which we're always comparing to based on our size, Louisville, Kentucky, I could keep going, but how are they open, how are they back in person, and we haven't seen these dreadful spikes that I think we all, rightfully so, are concerned about. Are they doing something magically that we just can't do here? I mean, what's your medical professional opinion on districts? I'm sure you may have, maybe you can weigh in on what you've seen around regionally and nationally that they're doing and that should give us some confidence, perhaps.
So I believe that Dr. Contreras has been very much engaged in the conversation nationally with all the school districts, large school districts that Guilford County compares to, and had conversations with those school districts around their practices and operations. I know that from a health director perspective, the conversations that I'm having with with my colleagues around North Carolina, we are seeing very similar trends, and my colleagues in other counties are having a very similar conversation with their school districts around metrics and mitigation strategies. So I will let Dr. Contreras address that question. She has more information.
I think where they are struggling, and I just spoke to 4 of the superintendents this morning, is more with after reopening, the struggle with substitute teachers when there's quarantine. So they have not seen COVID spread or transmission, but they do see cases. And I think Dr. Van will tell you there should be no expectation from anyone that we will not have cases of COVID in schools. The problem is when you have to quarantine and you have to send teachers home, students home, that there may be cases where you can't fully staff the building. So that is one area where we're going to have to really manage expectations and understand that's why the district, the board invested in the one-to-one initiative, was not just to have this to stay home for 2-3 years, but to know there are going to be days you're going to be in school. There may be days you have to work from home because of quarantine, but we're still pushing to return to school. But it won't be the way in which we normally experience school. But they have not had any super spreader events in some of the districts you've mentioned.
If it's okay with the board, I would like to continue with the presentation, if that's okay. Okay, so the next part of the presentation is just going to go over some of the information that we are able to gather here locally in Guilford County. Some of the graphs that you're looking at will probably be something that I'll go over briefly so I can talk about the way that we're seeing positive cases, COVID-19 positive cases in the school-aged category. And the number at the bottom of the graph represents the month. So if you see November is month 11, so that's why we have the lowest number of cases there. We're still working on those cases. And then going back, we're looking at October, September, August, all the way to the beginning of the pandemic in March. The categories here, we're looking at the ages 1 to 4 in the pre-K category, ages 5 to 7, kindergarten to 2nd grade. We're moving into the red category, which is ages 8 to 10, grades 3rd to 5th. And then ages 11 to 13, grades 6 to 8 is a yellow color. And the last color is just a lighter blue, which is ages 14 to 19, grades 9th through 12. So just by briefly looking at the graph, you will identify the fact that in the majority of the months, the older children in the high school category have been unequivocal. The highest number of cases, that is not the word that I need to use tonight. So the ages 14 to 19 are the number of COVID-19 positive cases that we're seeing the most in the school-aged children. We do have some of the other cases in the other age groups. However, they're fluctuating throughout the months. Sometimes we have the kindergartners and pre-K students with higher numbers. Sometimes we have the ones that are in the K to second, but they're very small numbers compared to the high school numbers. You have seen a similar graph on my presentation a few months ago, couple of months ago. So these numbers and these trends continue to follow that pattern, with the older children being more susceptible and more at risk for being infected with COVID-19. If we move to the next slide, we are going to have a breakdown of the race and ethnicity of these cases. The dark blue category is, the yellow category is our Latinx school-aged children. Light green is the Asian category, red is Black African American, and dark green is white, and our Asian population is represented by a lighter green. So again, just by briefly looking at the graph, you will see that we do have predominantly Black African American and white cases. Some months we have had more white kids being impacted by COVID-19, and then in October, the Black African American children are very similar to the their white counterparts in the number of cases that we're identifying. So you can look at the way that these cases are distributed from a race and ethnicity standpoint as well. The next slide is going to focus on hospitalizations. Fortunately, we have not experienced a lot of our school-aged children being hospitalized for COVID-19. However, we did have some hospitalizations. We can see in the graph that the majority of these cases are again in that older age group, the 14 to 19 cases. And then we also had a month at the beginning of the pandemic where we had 4 children that were between ages 5 and 7 that were hospitalized. In the month of July, we had 2 that were between ages 8 and 10, but the majority of them in the last few months have been high schoolers. So that is the distribution of hospitalizations for school-aged children. And the last graph is just the same breakdown of race and ethnicity for the hospitalization, with a pretty interesting distribution there for certain months compared to other months. In October, we have seen 6 Black African American kids that were hospitalized, with more white counterparts the month before. So again, it fluctuates from month to month the way that these graphs look. We are not seeing a typical pattern. We're not seeing something that is easy to identify or any specific trends in this particular graph. So this is the part that concludes our own Guilford County data for school-aged children, and it just moves into, it's a good segue in the last part of my presentation, which just talks about the research that is being shared with us, some of the emerging trends and some of the information that is coming out from our national partners, our international partners. And the first one is that children may be less likely to have and spread COVID-19 than adults. That pretty much shows in our Guilford County numbers as well, since the children in Guilford Guilford County represent a very small percentage of COVID-19 cases that we are reporting so far. Children, particularly younger children, may be less likely than adults to become infected with COVID-19 even after being exposed to someone with COVID-19. Newer findings also suggested adolescents and adults may be equally likely to become infected. This is the next slide, if that's okay to project it. Newer findings suggested because of mild to no symptoms, there may be an undercount of the actual numbers of children infected, and more cases in children may have been detected recently with the number of tests that are being available and with the promotion of testing. Also, young children can spread the virus. However, children under the age of 10 may be less likely to spread COVID-19 to others than older teens and adults. Also, newer research studies suggested younger children may be more likely to get COVID-19 from an adult than to spread an infection to an adult. And spread of COVID-19 is more likely within a household than not within a household such as a school. So that's why it's critical to talk about the importance of an entire household being mindful, the entire community being mindful of the way that COVID-19 spreads. Yes, I'll.
No. To what do you attribute the last one? Your last bullet, that is more likely within a household than not within a household?
Is because of how close the household family members are within that household. You know, eating together, being close to each other, sitting on a couch, watching TV, sleeping in the same bed, just having a lot of interaction within that household that is not necessarily taking place in other settings such as a school where those mitigation strategies are put in place, social distancing, facial coverings. People normally don't wear masks in their own household. So that's what that is attributed to.
Do you think the amount of time spent indoors rather than outdoors is a contributing factor?
That is true as well. We have learned that when you're in closed houses, or, you know, like in your living room, in your kitchen, in your own living environment, it is more likely for COVID-19 to spread. However, because the schools are big, wide, big classrooms, hallways, that is a little less likely for that transmission to happen.
Aaron?
Okay, yeah, no, go ahead if you have questions about this particular slide.
It was the previous one.
Sure.
About the school age, this,
Absolutely.
I'm sorry, the school age positive cases.
Okay, so it's the one before, yes, this one.
That one. Okay, on mine is, this is a question for the district, because I'm seeing that between the age group of age 14 to 19, grades 9 through 12th grade, we're seeing some of the larger cases. Is this what I'm reading here reflective of that? The biggest, and on my graph, it's blue, but this is the, oh, this is blue, there, okay. So with that, and this is a question for the district with understanding, what precautions will we be taking for AC classes where we have students ranging from age 14 to 22? How would this play, which is set to, under the proposal to start November 16th? As we're talking about the small children relative, I'm assuming, to the proposal for K through 2, but based on the entire proposal, adaptive curriculum classes are set to start on November 16th, which have an age range from 14 to 22, which is your largest color. And so what will that look like for those teachers as well as those students, or are we modifying AC because of the risk groups involved?
We'll be glad to talk about that. One thing that our Duke Consortium did point out is that the adaptive curriculum classes, and I'll ask Dr. Carr to speak to this, those students were less likely, or least likely, to be around anyone. They're not driving around, they're not at the malls, so they are probably less likely to transmit the virus to others because they're not out and about as typical teenagers are out and about. So one of the reasons you see teenagers spreading COVID the way they are is because of teenage behavior. But many of the students in your public separate classes, in some of our adapted curriculum classes, don't engage in those typical teenage behaviors. Dr. Carr?
Right, and I would say a lot of the activities that are planned for those students right now outside of school are virtual as well. And so a lot of the socialization opportunities come either from within the family or come through different programs and services that are available, many of which are not currently operating. But in terms, to answer your question more specifically, in terms of what additional steps we are taking, the PPE is going to be different in our EC adaptive curriculum classrooms as well as in our public separate schools. We will have face shields. We'll have the surgical medical grade mask that will be available. They have gloves available in our public separate. They have gowns available as well. And so there are additional precautions being taken place for that. The EC department has developed dozens of special protocols, health protocols. Those are all posted on our website to really try to specify what that would look like to help mitigate against any potential spread.
With the follow-up to that, Dr. Carr, then when will those EC and AC classes and public separate schools actually have that? Because as of today, it's my understanding they don't. They don't have the face shields. They don't have that equipment. And so if you're looking at an estimated date of November 16th, then that leaves 6 days or so to have that equipment. So do we have it and haven't dispersed it, or are we expecting the shipment in? Just to be transparent about where we are, because now we put it out there that there have been changes. And if there's not equipment, then we're going to be inundated with I don't have. And
well,
I understand.
First of all, I don't know. I don't have information that says that they don't have that information in the schools. Whether it's been distributed to the staff or not is a different issue. Secondly, we do have plenty of these medical grade surgical masks available. And we are very pleased to learn today that in addition to that, the Public Health Department has received a donation that they are forwarding on to us of an additional 200,000 surgical masks. Those certainly haven't arrived yet. So we do have our chief of schools and our SSOs checking on every single delivery. And certainly our new executive director over special education will be following up on all of that.
Ms. Henry just indicated the schools do have it.
They have the face shields. They have the equipment that you
The face shields those came in weeks ago. The masks came in weeks ago. We really have enough it's certainly the first wave to get started. I think sometimes, and I know in schools that I have personally visited, the principals have showed me the storeroom where everything is stored. Now, they may not have distributed them to staff yet because they don't have students yet. And I think there's, just as sometimes with paper and other supplies, sometimes they keep things, out of the way until they're really needed. But we're not aware of anybody not having what they need. And we are also sending people out to monitor on a regular basis. And that is one of the questions that gets asked every time somebody goes out. Do you have what you need? Do you have, and there's a list, do you have this, 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 and this? We're also looking at partnering with the health department to do some additional training for our EC staff on the appropriate way to use the additional PPE that they have available. How you take on and off gloves and things like that is a little bit different, and they want to make sure that they have that information. So that is still in planning phase.
So then would masks for AC and EC and public separate schools, would that be mandated for children, or is there a different way you have to do that? Will there be general reminders, or we'll make sure that staff maintains necessary PPE, and then you try to negotiate those reminders and behaviors as needed?
general, we're requiring face coverings. However, there are always going to be some exceptions to that based on the child's IEP and disabling condition and needs.
Thank you.
Just a reminder that our representatives from the Department of Public Health have time constraints.
Yes, I just wanted to make sure that I also mention a few things that are not on the slides, just a few talking points that we know that when we bring more individuals in a specific location, the risk of transmission is going to increase. However, if the protocols that have been put in place by the school system are followed at all times, they will greatly reduce the spread and transmission of COVID-19. Also, the mitigation strategies are all considered layered approaches. There has been a new study that has shown the fact that each one of these mitigation strategies can reduce the risk of transmission with a specific percent. For example, social distancing can reduce the risk by 85%. Always wearing a mask can reduce the spread by 77%. The duration of contact with somebody less than 15 minutes can reduce the spread with 76%, and frequent hand washing can reduce the spread by 67%. So again, it is very important, and I think that I've repeated this before, that all of these are overlaying on top of each other, and neither one of them is perfect within itself. They need to be taken as a team. So we like to think about us as working in teams. All of these mitigation strategies are part of a team as well. Also, I wanted to have take a little bit of time to talk about face coverings, masks, respirators. I think that Dr. Carr had a great kind of introduction to this. I have been communicating with the Assistant Superintendent for Exceptional Children's Program, and I believe that that particular conversation will take place on Thursday, just to make sure that all of those team members feel comfortable with the use of that protective equipment, since it is a little bit of a higher level, higher grade protective equipment, and we just want to make sure that everybody feels comfortable with taking off the gloves, putting on gloves, gowns, face shields, masks, and so on and so forth. Certain things that are do, no do, and so on and so forth. But today, I just wanted to, I brought a couple of masks here to just show you. These particular ones are considered N95 respirators. I know that a lot of times they look like just typical face coverings, just masks. They're not. They're N95 respirators. This is a medical grade mask. That is the one that is recommended for a higher protection, such as the one that we will, that we talked about with our school leadership in those exceptional children classrooms where interaction might happen a little bit more closer than in other classrooms. The N95 respirators are not recommended for any other team members other than healthcare professionals that are working with patients that are infectious, that have various other communicable diseases such as tuberculosis. Even our paramedics and EMTs, they use a medical grade mask. They do not use a respirator. Also, I want to mention the fact that having a respirator is part of an OSHA program, a respiratory protection program. It is not just taking one and putting it on. It requires fit testing. It requires a medical screening. It requires an entire protocol for that to happen in order for that respirator to be efficient and effective in the way that it's being used. Using a respirator without that OSHA developed program is not a recommendation. So there are actually contraindications for respirators depending on the medical conditions or different physical instances that might be unique to that person. So I just wanted to make sure that I clarify the stance of our professionals in the use of respirators and the medical grade masks. If you have any other questions for me, I'll be more than happy to take a few more. I have references to the end of my slides if you're interested in reading any of the studies where the information comes from.
Hold on, Diane, Darlene's next, and then you.
tell us a little bit about long hauler syndrome? I think it's a complication of COVID-19.
I am not familiar with the long hauler. I know that there is a complication of COVID-19 in children, which is a exacerbated immune response to the inflammation. However, I am not here in a medical from a medical standpoint. I'm here as a public health professional, so if we need to bring medical hospital-grade infection prevention pediatricians to talk about that, I think that would be ideal.
I know that's a real concern of teachers, so I would like to know as much as we can about it and what we need to do to prevent it, if there is anything. I want to understand from you, are you saying that students don't transmit the virus to other students, or they don't transmit the virus to their teachers?
There have been studies to show that younger children, less than 10 specifically, don't transmit the virus in general, not to other students, not to their teachers, not to their family members. So in general, not to a specific category.
Isn't it true that COVID is very new, and so there's a lot of studies going on that there's a lot of things we don't know about?
That is also true.
And shouldn't we be cautious? These are lives of people that we desperately need, children and teachers, to teach our students. If something happens to them, who's going to teach the students?
I'm only sharing with you
we've got the virus
research.
raging here. I mean, it's raging. You know it. The numbers show it. So why we're even thinking about sending back more students and teachers and exposing them is a crime to me. And I just want to bring up something to you. This is a real story. There is I'm not going to say the name of the school, but there is like a child care facility near the school. Apparently there's a cluster that developed there. And this, I don't know for a fact whether the students, I'm assuming the students transmitted it to the other students. And then they went to the school, and so now there was a student positive in the school in pre-K and a positive case in the kindergarten. So there's 2 classes now that are quarantined, as well as their teachers, and there's 3 EC teachers in that school. 2 of them are quarantined. 3rd one is going out on medical leave. Folks, we have got to see what's going on. And this is just with voluntary pre-K and K. We are risking the lives of our students and teachers. And that's unacceptable, and we shouldn't be doing it. And all of you need to pay attention, because if something happens, it's going to be on all of us. I want our children back too, because it's best for them to learn face-to-face with their teachers. But I visited a school today, and let me tell you, it's not going to be like, you know, Dr. Contreras even admitted that. School is not going to be like it was. It's very, very different. And we need to pay attention to this. We do want our kids back, but not when it's raging. We're in the red now. I mean, who in their right mind wants to send kids back when we're in the red? Dr. Fauci wouldn't do it. Dr. Murphy says, you know, you need to have a low prevalence of the virus. So why are we even thinking about doing this now? Because if we lose our teachers, they're not even going to be able to have remote instruction. And even though people don't like that, I think it's better than no instruction. All right, that's it.
Diane?
Okay, Dr. Van, if I can ask you, you've been following the cases that have been identified within GCS. In your professional opinion, how have we done as far as the rate of infection among staff?
Well, taking into consideration that since August 24th, we have worked 122 cases in all of the schools that had teachers or staff or children in it. That is a very, very, very low number compared to all of the other cases that we have in the county. So I believe that the school district has done a really good job putting all of the mitigation strategies in place. The majority of these cases are community-acquired cases.
Thank you.
All right.
I believe that this is going to be the last question, if that's okay.
That's fine. As it relates to the data, Dr. Van, because what I've kind of been wanting is for us to frame and to actually contextualize what exactly the data that we're seeing. When we're talking about young age children, we're talking about children that have been in quarantine, since March or April, that may not have been around children of their same age group, that may not have been in social settings. So you're seeing the older the child, the more likelihood of them being in a social situation. This is not reflective of what will happen if we open doors. This is a reflective, with doors closed, what has happened with human error and human element. Correct.
Social part of it plays a part in the transmission of COVID-19.
This is not, but the numbers, the current data is not reflective of, of course, obviously, children are being reported from, but we're not controlling for, is this child, did they get it from a school or did they get it from, you're tracking transmission, but looking at the data, it's not reflective of the fact that it's not with schools, full open or very open in very limited capacity. This is based on children at home and their social interaction as they get older and the risk groups based on their ability to be mobile. This is not reflection of our children, kindergarten and pre-K and first, second grade based on the data are going to be fine. That's not what this data represents. It represents them being at home right now and children being with that. But I don't want it to be used or manipulated as a justification that a projection of what it's going to look like. This is not really, for me, for this example, it's good information for me in my decision on what I'm going to do, but it's not really relative to opening schools because these children are at home. I'm not getting a side-by-side comparison of where you've monitored cases with another school district. This is just within Guilford County. So this taking back charter schools that have been open, daycares that have been open, and people commuting with their children and children communicating with siblings and loved ones. It's not reflective if we open the doors.
That's correct. It's just the information that we have right now in Guilford County. And is the cases that we're seeing right now.
Thank you.
Yes. Thank you so much. I appreciate it.
Dr. Van.
Thank you, Dr. Van. We appreciate our partnership with Public Health, and we thank you for sharing your time and expertise. Dr. Sarfo has additional data regarding learning loss.
Good evening, Dr. Contreras and the board and the school board. Thank you. This evening, I'm going to briefly highlight learning loss and some research that predicts learning loss, as well as early evidence of learning loss from this fall testing in districts. So major studies have been released that predict learning loss during COVID. The most commonly referenced one is from NWEA. It predicts that students will return with less than 70% of learning gains in reading and 50% of learning gains in math. Which is about half of what they should be knowing, with more learning loss occurring in the earlier grades. Building on these estimates from NWEA, Stanford University's Center for Research on Education Outcomes used map assessment data to predict learning loss in the 19 state areas that heavily use map assessments. Their results estimate that North Carolina students will have the second largest learning loss estimate in reading, behind Tennessee, and the fourth largest learning loss in math. McKinsey and Company's research states that learning loss will be greatest among low-income, Black, and Hispanic students, as these students are less likely to have access to high-quality remote learning or to a conducive learning environment, such as a quiet, safe space with minimal distractions, less likely to have devices that they don't need to share, high-speed internet, and parental academic supervision. Data released from the Center for Research on Education Outcomes shows that students could be losing as much as 183 days of learning time in reading and 232 days in math in an online learning setting. Every other week, I'm on calls with research directors from other large urban school districts. Early testing results from many of these districts are showing evidence of this research that predicts learning loss, especially in math and reading, and especially among students of color and in poverty. Dallas Independent School District, for example, is one of the first to publicly release their fall test data and have described the learning loss as horrifying and devastating. Half of all Dallas ISD students experienced learning loss in math during COVID, and nearly 1/3 slipped in reading. Vast disparities were found between Black and Latino students and the rest of the students in the district. Projections for meeting grade level proficiency on state assessments ranged from 7.5% to 17.9% among Black students, compared to 41.8% to 61.2% for white students in the district. Declines in student performance were also found in Washington, D.C. recently, where early literacy among kindergartners dropped by 11 percentage points. First graders experienced a drop of 12 percentage points, and second graders a decline of 7. We will test our students soon to understand and estimate learning loss, but we do have our first quarter grades in core courses as another measure of students' academic outcomes. In those results, we find that 40% of our students in grades 3 through 12 failed one or more courses, compared to 29% in the first quarter of last year. The highest rate of failure is among our Hispanic, American Indian, Pacific Islander, and Black students, with the lowest failure rate among white students. For example, 53% of Hispanic and 46% of Black students are failing more than one course, compared to only 26% of white students, who represent 30% of our student population. In addition to academic losses, we know our students are experiencing social and emotional stresses that are also impacting their educational experiences, and I'm happy to share research on that if you're interested. I say all this to say we are starting to see the impact of COVID on student learning, with large estimates of learning loss and course failure in large urban school districts, especially among students of color and students in poverty. This learning loss will not be easy to overcome and will worsen existing inequities in student outcomes, particularly in a district like ours that's comprised mostly of students of color and students in poverty. The added social and emotional stress of this pandemic will likely lead to longer-term harm for students and for society.
Thank you for that summary. So to conclude, as you've heard this evening, the COVID-19 pandemic is creating significant challenges for our students and their families, challenges that will not be eradicated in a year or two, but will likely be lifelong. The COVID-19 slide is no longer merely a feared future state product of take data modeling. It's here, and it's having a profound impact on our students in Guilford County. At the same time, we are dealing with a global pandemic that has disrupted life as we know it and is frightening in its intensity, as some of you have expressed. None of us feel good about where the community health metrics are in Guilford County and the state of North Carolina. Recommendations before you were not and are not an easy one to make. In fact, it is one of the most difficult recommendations I've had to make in close to my 30 years as an educator. As one researcher said quite bluntly, the findings regarding learning losses are chilling, with recovery taking years. And that was before the pandemic stretched into this fall and the 2021 school year. And although students at the best full-time virtual schools can do as well as or better than those at traditional ones, most studies have found that full-time online learning does not deliver the academic result of in-class instruction. I am concerned about every single student in Guilford County, as is every member of the school board. Many of our exceptional children, however, have had tremendous difficulty due to their disabilities using the technology to access their education, and education that they are guaranteed by law. Once again, Black and Latino children are at the greatest risk of not receiving high-quality online instruction, not just here in Guilford County, but nationally as well. According to McKinsey and Company, this factor alone could exacerbate existing achievement gaps by 15 to 20%. And we already know these children come to school behind their peers. After reviewing the academic and scientific literature regarding these issues, as well as speaking to colleagues who lead the nation's largest school systems, I believe we must begin to return some students to school for in-person learning, particularly in our elementary schools, and for those who are least able to access learning remotely, including our students with significant disabilities who are served in our 4 public separate schools and our 91 adapted curriculum classrooms. Now, I just want to say, to avoid doing this could lead to generational devastation. Now, all of us come to our decisions with some context. I sit today as one of a handful of Black female superintendents in the country, and I follow in the footsteps of educators like Anna Julia Cooper, Charlotte Hawkins Brown, Fannie Jackson Copen, Mary McLeod Bethune, Nanny Helen Burroughs, Black women who have dedicated their lives to the education of neglected people, vulnerable children. And I will continue in that great tradition. Now, some will say the Board of Education, the superintendent, does not care about teachers. Some will say the Board of Education, the superintendent, doesn't care about children. Neither of these statements is true. In fact, we didn't strike this match, but we're left to put out the fire. We're in a no-win situation. But I often say when you find yourself in a no-win situation, you just stand for children. Now, for some board members, that means standing for children is don't go back to school, and that's okay, they're right. For others, that means go back to school. They're right too, and nobody should be judged for their vote. They're trying to make the best decisions for children. So the administration recommends that the board approves the additional metrics regarding academic outcomes, mental health considerations, and the emerging science and data regarding the limited impact of reopening schools and community health metrics regarding COVID-19. The administration also recommends that the board approves the recommended phased-in reopening plan as presented in your board document. Thank you.
A list for a question one.
Okay, Diane, and then Winston.
Okay, Dr. Gutierrez, as a excellent educator, I think you also know that we have the answers to help kids to overcome whenever they've gotten behind. In the time that I've been on this board and with you, you have given us a number of different ways of attacking bringing children from behind. Do you not feel that if it winds up being next year, though this is a long time, this is probably the longest that we've had this number of children out, that our educators and other educational staff cannot do a job to bring kids back up to a level that would be acceptable in their educational lives?
Thank you. I've thought about that question. It's a great question. So I think to answer, we have the history of American education, and we've not been able to make it up, the achievement gaps, when we've been in person. So to think that we can do that online, I think would be expecting a great deal from our educators when there hasn't been an influx in resources in funding, professional development, additional teachers. So there have been others who have said, we'll just catch them up. But we've never been able to catch the most vulnerable children up, and they've been behind since public education has been a reality for all students, and meaning since we finally said all students are entitled to a free and appropriate education. There has never been a time when all children have been on equal footing. So to believe that we're going to close this gap, I think, is really wishful thinking, and it's not going to happen.
Okay, but as you said, this is a situation that, one, we've never dealt with to this magnitude, and two, we're trying to continue to build the plane as we're flying it. If we are hopeful that with the vaccine or whatever, that we might be able to bring back an in-person school in the 21-22 school year, should we not prepare ourselves to be able to try to do the best we could at that point to begin to mitigate what we have gone through in this school year?
I think so, and I think the teachers are doing the best job they can right now. Our TAs, our other support staff are doing an incredible job, and I would say the vast majority here across the state and across the country are doing more than they've ever done before. I don't think, though, that that can make up for this sort of learning loss that we're seeing. It's an unprecedented amount of learning loss. So it's not the normal achievement gap we see that is devastating. This is even more devastating than what we've seen in the past. So I am one who maintains hope. I talk to the principals all the time about radical hope, even having radical hope. But I'm also realistic about what we're able to do. And I think that missing out on kindergarten and reading and having access to people face-to-face who understand the science of reading is just incredibly devastating and will have lifelong implications.
I have a procedural question. If you want me to wait and ask it later, or go ahead and ask it now.
Diane, until after we get through a few speakers.
Sure.
Thank you. Winston?
Thank you. So like my colleagues, I've been reading emails, I've been talking to parents, grandparents, some great opportunity on Election Day to talk to lots of folks as I work the polls on behalf of the bond. I've talked to principals, business leaders, and weighing all of this information, the nuance of it, and then somehow how sometimes it's presented in black and white ways. I certainly don't think all of the weighing that I've done compares to what the leadership team and the superintendent have done, and I deeply appreciate the work that you all are doing every day, the health director and the teams who are here, who are doing this 14, 18 hours a day. I will say I think principals have had a particular impact on my view on this, but lots of folks, when I really am able to get into a nuanced conversation with them, have impacted my view. But I do have a question about a slightly nuanced, because I've been living in the nuance of this, that's where I find myself dwelling, others dwell in other places, of what would be the impact of moving forward with pre-K and 2, but pushing off the 3 through 12 into January, so that this holiday season, so that we really do have time to get those earliest learners in the building, to get the system moving, the wheels on the big bus beginning to churn, and holding the 3 through 12 in some graduated way into January. What kind of impact do you or Dr. Sarfo or Dr. Oakley think that would have on kids and on the process of opening?
I think it would certainly be frustrating for another delay, and I believe even a few days matter in terms of the education of children. I also, however, believe there is something to the argument about the holidays, and I think it's just 8 days. Is it just 8 days that they would be present in December before the break?
If they returned on the 7th, as is in the proposal, they would be in until the 22nd, so 5, 10, 12 school days with a remote day on the 23rd.
It would be 12 days. So I think if there was a commitment and parents understood, if it's the board's desire that we want 3-5 to go back, we prefer after December, I think there would certainly be more comfort with teachers and some parents, but I think there would also be some frustration. But certainly it is 12 days.
We could move forward with pre-K through 2 and the categories of special students we've talked about, the EC students who need that specialized care, whose parents are really struggling.
There's one more group. I think there are 46 students who would just go back for their CNA practicum.
Oh, yeah, I saw that, we had that earlier discussion.
But
because
it's not all day, it's just for a CNA.
they lose their shot at getting their certification if they don't get back in.
Correct.
So, can I make a motion for that? I don't know that we have a motion yet to accept the recommendation, but, or do I, Dina?
You can make a motion, and then the chair can have discussion after the motion.
I have a question.
I would like to make the motion that we move forward with an adapted version of what you are recommending, that we do pre-K to 2, EC students and the CNA students, but that we hold the 3 through 12 till after the holidays as a way of honoring the nuance of the situation and the data, but that's how we would proceed. Till January, yeah, well, we were going to, I think you would graduate it in, I guess. I'm looking at January 7th and January 11th, so I don't know whether you'd bring 3-5 January 7th and then something else.
You're saying the motion is to make one revision to the recommendation to move grades 3 through 5 to January.
Yeah, and I don't know if that means from an operational standpoint, you would say, I want to bring the 3rd, 4th, and 5th graders back on the 7th and bring the 6th graders back later. That would be an operational call.
Ms. Henry, is there any transportation issue with that, with moving them to the January date? What is that January date?
January 5th. January 4th is a Monday. It's a mandated work day. January 5th is a Tuesday.
January 7th, we were going to bring 6th graders back.
A transportation issue with that?
Would that delay the others?
Would be January 5th.
A transportation issue. Bringing the back later. We've already got all of those. A bus route, all those that indicated they wanted to return in person. So create a transportation.
You'd bring them back with the 6th graders on the 7th?
Yes, because
the 6th graders would be, they are coming back on a Thursday, so the 5th would be Tuesday.
You wouldn't bring a cohort back for just one day. That's why we had January 7th originally, so that Thursday, Friday cohort would be the first one to return, and that they would return on Thursday, January 7th.
Or on A, B days.
That's right.
I see what you're saying.
Yeah.
That's your motion?
Yes.
All right, Anita seconded that. Now we have people that were in line, and you can ask your questions as you were in line to speak, Byron.
Well,
No, you were after
Yeah.
Anita.
question for me is the total number of days we're projecting to start on the 12th, and you said we have 12 days of instruction, Dr. Oakley, for December with the holiday. How many days of instruction from the proposed start date would we have for the rest of this month, counting the holiday?
Depends on which student group you're referring to.
So, see, November, so that would be K through 2, and then the group that's set to start on November 16th. So that would be AC, public, separate, and I think, is that 3 through 5? Starting November 16th? Well, it's the public, separate, AC, November 16th. What, are there any other additional grade levels?
Based on the motion or the memo?
Memo.
There's 12 additional days between November 16th and December 7th for that cohort of students who is proposed to return on Monday, if that answers your question.
Is that 24 days?
From the proposed start date of November 12th, we would have 24 days left for the year.
It's 24 plus what I cited earlier, so.
Okay.
On November 16th, in the proposal, we have students in self-contained classrooms, grades 3-12, students in public separate schools and specialized programmings, as well as those nurse
So
students.
Oakley, if you start counting on Thursday through December, when the break starts, how many school, I think that's what you're asking, how many school days are
How many days of instruction between the start date of November 12th
November 12th?
and till Christmas break?
26 plus the remote day on Wednesday, December 23rd.
Okay, so then my question is, with 26 days, and we're already doing a phased in, so depending on which cohort, that's going to be even less. So our pre-K through second will have the most days of instruction staggered out by our November 16th start date of, well, I understand the motion, but with the memo plan of the 3 through 5, what, in terms of what type of instruction can be expected to have in 24 days on average between now and the end of the year to push this as a thing? I see that, Winston is, amicable enough to, her motion to remove 3 through 12th grade, but what is pushing it going to achieve in terms of education? To your point, you said we cannot make up the loss. The national report that Dr. Soto spoke to earlier it's actually part of a larger of 10-year and 30-year gains in reading and math, and because we've had the achievement gap and loss of instruction. We had these issues before COVID of achievement gap and quality of instruction in classrooms. We had those issues pre-COVID. So it's relative, but it's not within my scope because I understand what we were dealing with before. It's exacerbated, yes, but what will happen in terms of education, I'm not clear on what we will expect to happen in 24 days.
I think it makes a big difference. I think you said 24 or 26.
24 for 26 days.
26. Also, just remember.
26 days is more than 10% of the school year.
I do just want to point out again that we are remote after that week after Thanksgiving, which we've been throwing those days in, but there is a difference.
So we have that week after built-in remote
Your
schedule.
school is occurring.
School's occurring.
But it is remote learning.
It is remote learning for that week, but so then that's less than the actual in-person physical proposed days. You can't count the remote learning, so actual in-person proposed, with the memo proposal of in-person instruction. So then are we looking at actually 14 days or 16 days? So we can't count the week, that's remote. That's already built into your proposal. Or am I getting that wrong?
You're taking out too many days.
We said we have 24 to 26 between November 12th and Christmas break. We have a week built into the calendar under the proposed memo for remote learning, so we have to deduct that from actual in-person instruction proposal based on the memo. So my rough calculation, we're talking about mitigating 14 to 16 days.
But 14 to 16 days matters. Remember, 176 days is a full school year, 17 days is 10% of a school year. They've been out of school since March. They had the summer slide, and then they've missed school for most of the entire first quarter. We cannot forget the adapted curriculum students, or students in adapted curriculum classes. Many of them are having extraordinary difficulty assessing the curriculum or assessing their educational program, a program they are guaranteed by federal law. So 16 days may not matter to some. It matters a great deal in the lives of students who cannot use the technology at all.
Which I understand, and I believe that it does matter. My concern is the fact that Guilford County overall, based on the numbers and increase, it is not mattering as a county in terms of the social distancing and the numbers going up. Just like Guilford County did their part in supporting the bond and getting out the vote, there's also a social responsibility to make the numbers and the risk level reduced for students to safely and staff to return to school. And I don't feel that Guilford County has done that. And so when I'm looking at based on my math couple of days, it's not worth it, and we don't have a projection of putting at a risk level. And so I would like to make a substitute motion that we again as a board consider reopening school on January 7th.
Second. Any questions?
A vote.
I'm still.
We're just making that substitute. All right, we don't have anything to vote with. All those in favor of the motion?
Do we have to vote on that?
We have to vote on the substitute motion, then we can have conversation about the substitute motion, right?
Well, actually, we need an open and closed discussion.
My discussion on the.
We can't just rush through discussion.
I'm sorry. All right, so then we can have discussion before we vote on it. All right.
Correct.
And Linda, then Anita, then Kim.
Well, I want to go back to the first motion. While I was sitting here, I had two mamas text me that are special needs, that I have been getting phone calls from. I have been getting emails, texts from. Like I said, they just text me, two of them, immediately, and said, I want my child, one is at Gateway, and one is in self-contained.
Can you pull your mic down?
Self-contained parent. Her child is harming herself, be out of frustration that she cannot navigate the situation. I have also talked to that particular child's EC teacher, and she says, I'm ready to go because my kids need to be in school. The other mother is also ready for her medically fragile child to be in school, right? Because of the harm being done. I just got these two texts after they immediately went, oh my God, they're not sending us back. Number two, I got another message from an administrator that will be doing pre-K through 2. Message was, we're ready to go. We're ready to go. So what I'm going to tell you, I understand, but when you look, I also have talked to teachers that are doing the voluntary, pre-K and kindergarten. And the teachers are saying they're coming in drastically behind, and trying to catch them up at this point is going to be a challenge. I dealt with summer slide with my own child. It is intensive if you do not have a natural reader. It is intensive effort. I also, because I worked that child so hard, tried to take a break the next summer. I didn't make that mistake again because I immediately slid back again. Back several years ago when Ivan Canada was doing, amazing things with low-income students, I had the opportunity to go listen to him. And they were talking about the gains they made. I said, how long, how much can you make up in a year? And he said the best they could do with intensive remediation was 6 months in a year. Intensive. So our kids are just trying to, you know, we can say we can make that up, but also I will say we haven't been able to make that up. We haven't been able to push that reading level up. We haven't been able, and now we're going to have kids so much further behind. My thing is, if you've got parents, which we have over 2/3 of parents that are willing to send their children to school. I know there are other parents that are not. This is a passionate, polarized situation. I got it. But somewhere, what happens in January? What happens in January? What happens in January if the numbers aren't better? Are we going to, again, push it out? I mean, at what point do we go that we've got to do? There's no guarantees in January. Actually, it's probably less. That, I mean, there have been schools that have been in since September. And, you know, they're managing. I have 2 children in college. I have one in the hot spot of Charlotte, and I have one in the hot spot of Raleigh. And yes, there are COVID cases. And sometimes you know, they have to switch over to remote, and they're dealing with that. But what I'm hearing, and people that are contacting me, and I am hearing a lot of teachers are very concerned, and we definitely need to do everything possible to mitigate anyone that has serious concerns about health. And anyone not doing that, that's, you know, we've got to do that. But I also see the other side of these parents that are desperate to get these kids back in school. So, you know, it is hard. It's hard, and no one's going to win here. No one's going to win. Like I said, it's a very polarized situation. There are people and parents. There are teachers out there ready to go. I know we hear from a lot of the teachers that are not ready to go. But I also hear from teachers, as I said, the EC teacher of the one student is ready to go. So, and, you know, I see people living their lives. I see people out. They're living their lives. They're taking precautions. They're living their lives. I'm living my life. You know, I do go out. You know, I go walk and, you know, I go out and grocery shop. I do my job, you know. So people are living their lives. These children have to live their lives, and they have to be back in school. So that is what I have to say. I think the loss of education is horrendous at this point, and that we got to do something. And if someone wants to guarantee me in January things are going to be good and we're going to put kids back in school, then all right, give me that guarantee. But if we can't guarantee that come January we're not going to have this same conversation, then struggling.
Okay, I seconded Winston's motion, but I have a question. If we roll back 3rd, 4th, and 5th until the 1st of January, what effect does that have on the rest of the schedule, if any?
3rd, 4th, and 5th? I didn't hear a motion to do anything else to the rest of the schedule.
So if 3rd, 4th, and 5th goes back on the 4th, is
The
it?
5th, because the 4th is a
5th.
teacher workday.
Okay.
Everything else would remain the same
Then-
based on the motion.
2 days later, the 6th?
Correct.
Would, okay. Thank you. One more thing, not really a question, but I agree with Linda that this is a very polarized situation. But I also remember that 67% of the parents want to go. They're ready to send their kids. I think what parents have found out during this time is that the role of a teacher is not something they're well-suited to fill, and they're ready to get their kids back with the professionals in learning and develop those relationships. I agree with Linda. If I thought we would not be having the same conversation after the first of the year, I might feel a little differently. But I don't think perfect is achievable in this situation. And not try to get kids back in school. What's the word?
all the information and all the data, we've got to start learning to live with this virus. Like polio epidemic, we built an entire hospital in Guilford County. Our schools remained open. And I think we've all approached this in a measured, deliberate way. Again, I don't know how much longer we can really discuss and debate and pontificate about it. I think Kim said it best with her comments. And while I appreciate a compromise, yet another compromise about diluting the reentry plan and for those third, fourth, and fifth graders, third grade is one of the most important years of a student's life. That's the year they learn to read, at the end of that year. I cannot in good conscience support that. I can't, given the fact that we've been 6 months out of school. And all these are, I appreciate all the input and ideas. I think the recommendation we have has accommodated, to use Ms. Irby's point, accommodated as many people as we can. At some point, there are just no options left. And we've got to make a decision on behalf of the parents, the community, the children. Really try to apply the greatest good to the greatest number of people. And we know the surveys, we've seen the data. Now we have more data that I think what we all knew, which is the loss of learning and the impacts are going to be with us for decades. And maybe it's 12 days, maybe it's 16 days, maybe it's 26 days, but those days are critical in the life of a child that's on the borderline, being able to read and be proficient in critical areas. It really can only happen in a classroom, in front of a quality teacher. So again, I appreciate the original motion, and I appreciate the substitute motion for that matter, but I think that I'll be voting.
Are you making a substitute to the substitute?
I think we will vote on those two and up or down. And I mean, my motion would be, if I guess I'm looking at our board attorney. Do we have to vote on the first two, or can we?
Yeah, you vote on the substitute.
Well, my substitute to the substitute is to adopt the recommendation that we have before us, the superintendent's recommendation on the reentry plan and the metrics.
You need a motion on the metrics first, actually. Or did you combine the?
Well, I thought it was combined.
You combined it?
Yeah.
Fine.
I'm combining the two that we.
Okay.
Yeah.
Thank you, Pat. In that.
Okay.
So you vote on that first, unless you have more discussion.
Do we have a second?
Byron.
Yes, Kim seconded.
Kim.
That's the third motion.
Right.
You can substitute, but
Yeah, you just work up the chain.
right, Byron?
So I really wish we would have held comments until the end, because I'm not understanding, based on the voting record for the past 4 years with this board, when have we cared about all children? When it has come to professional development, funding for curriculum, PD training, additional activities, programs, ventures, when have we been consistent on supporting all children? Or is it because, based on the graph, white children failed more than black in terms of the first quarter report that we had at 40%? I have mothers of every race and nationality calling me with very real stories and very real issues, and that does not motivate my reasoning for closing school and keeping students and staff safe until January. It is because looking at the number of days and what it would take to go back, but other districts larger than us and smaller than us have done it since August and have had to open and close so many times, it wasn't worth it. And for 24 days of instruction with holidays, which are guaranteed to spike COVID rates, it's not worth it. But when I look at our voting record, which is public and we can audit, we have fought the progression. Black kids were having an issue last year, and they've been having an issue since before 93 when we merged. We merged to provide more funding and equity, and that has not happened consistently in this district. But because children are at home, we now have taken a majority tone of all. Poor moms and dads, all. They're going through and suffering. What about the black parents that were crying and raising hell at the board last year? We met them with silence. And thank you for your email and thank you for your time. So my issue with the board is whatever you decide to do, be consistent. If you want to put them back in school, that is not going to drastically help black kids and kids with special needs. It's not. Advocating for funding and not pushing back on professional development, regardless of the personal issues, and believe me, I know, with whoever's in administration, current administration, regardless, you have got to make a commitment by sending these kids back that you do everything within our budget to give them what they need to thrive. We cannot say pro-life and then have a mother struggle or a family struggle with providing what their children need. To say, yes, we want your child to make it and thrive, put them back in school, and then they still come to school without the supplies that they need. They have teachers, lateral entry teachers, struggling with professional development and to understand and have consciousness about what to teach and how to teach, while we are struggling to find dollars and we are writing grants out the wazoo to try to get what these teachers need. So if we're going to make that decision and substitute to the substitute, then you are committing within the realms of your position to actually fund better schools with the funding that we have and hopefully will happen. You're committing to curriculum. You're committing to the math program. You're committing to reading, that expensive reading program that we got. You know, you're committing to all of that by putting them back in school. Not to put them back in school so the people whose demographic that don't look like me that blow you up will stop calling, because they will continue to call, along with African American parents and our Middle Eastern parents and our parents who, you know, English is their second language. They are going to call and organize. They now know who we are. So if we're going to do it, then you're making a commitment to fund. Because even though I'm not longer on this board, I will continue to come after every one of you on this board if you back down from sending children back to school for 24 days and then don't fund them. And then there's a huge debate about how we're going to spend money that they need in the PD that they need. I'm going to have a real problem with every one of you. Be consistent, because we have not been as a board when it comes to all children. And just because our larger demographics are empowered to email and call and write and text us in the middle of a meeting, I was moved when it was black parents that were doing it. I was moved when it was poor parents and parents who just got here and were struggling to get a visa when they were doing it. I was moved, and I voted, and I committed. So now that we see now we have the all moment, let's do something with it. Thank you. And I'm ready to call the question.
The third motion, Pat, is your motion on the original recommendation for the superintendent? Yes. Okay. All those in favor?
Should we not at least go over what the metrics is for, I mean, did we go over that for the, I mean, I know I read it, I just want to make sure.
The superintendent did.
Do you want to restate it? You want it restated?
Can we bring it up on the? I know it is the same, but people need to know what we're voting on.
Lisa, if you can bring up that slide, that'd be helpful.
Metrics are simply to make sure that going forward, the board considers academic outcomes, social and emotional well-being, and mental health of students, and the school reentry, emerging science and data.
In addition to all the other established metrics, right?
It's the case incident, the positivity rate, and all those, right?
Those all stay. Mm-hmm.
Pat's motion was to accept the recommendation and the metrics.
Just say one.
Yes.
It probably is not going to.
No, but I know this is important.
It is important. This is from the Winston-Salem Journal. Over the weekend, the county school reported on its COVID-19 dashboard that 14 students and 50 staff members tested positive for the virus from November 2nd through the 6th, a 5-day period that included the return of about 570 students in pre-kindergarten and exceptional children programs. A lot more.
So all those in favor of the superintendent's recommendation or Pat's motion, raise your hand.
Dina, it would be better if you roll called because the public will have a very difficult time understanding who voted if they just all say.
All right, this new environment. Okay, Kim.
Sorry. Yes.
Byron.
No.
Blaine.
Absolutely no.
Yes.
Pat.
Yes.
Linda.
No.
Diane.
Oh,
Winston.
No.
Fails by a vote of 6 to 9.
You're next. 9.
I mean 6 to 3. Equals 9.
The next
Okay,
vote
the
then
next
would
one-
be Byron's. To delay opening until January
Okay,
7th.
and then it's Winston's. Okay, so Byron's is to delay all reentry till January.
Right.
And the metrics. Huh? The metrics are the metrics that are recommended here?
I didn't merge my motion with the metrics. I don't agree with the metrics.
It doesn't matter what's going on, just
It needs to be for that then board to evaluate and decide on metrics at that point where we are with cases and then make a decision to opening. It would be ill-advised, in my opinion, to make that decision. To hold future metrics, and we don't know what the state's going to be.
All right, so it's just to reentry January.
Yes.
January what? 5th, 6th,
7th was the motion.
7th? Okay. To reopen January 7th.
Without a metrics?
So without, if you're saying without metrics, then it's by any means necessary.
Have metrics.
We still have the metrics that we voted on, and since we've been calling it on a weekly or whatever, it's going to change. So that will be for the new board to deal with.
Carry over. Okay, so that's, yes, Diane?
okay, I guess my hesitation is, this question is to Dr. Contreras. If there is no opening until January, does there not need to be some other things going on between now and January? Or do we just, cut the lights off and come back in January?
I assume learning will continue the way it has, with remote and virtual and. Dr.
My
Contreras.
question is to Dr. Contreras.
Okay.
Yeah, by law, we have to have school, so we would continue remotely. I just want to make sure, Mr. Gliding, your motion is for who to start on January 7th?
The motion is that we would remain closed until January 7th. Between this board meeting and the board meeting scheduled in December, in terms of to reconsider the memo proposal at that time for the new board based on whatever metrics. I'm not going to lock this board in for a future board because it may change. We may not have the right back. So I'm not going to commit anyone in this room for future to leave it open for this board to decide again, but that we have a clear, excise, decision to remain closed.
Who remains closed until January 7th?
Okay. But Dr. Contreras,
Yes.
does there not need to be some other guidance, though, of what would happen between now and January?
I think there's an understanding that we would continue with remote learning until
existing
January
metrics.
7th.
And the existing metrics, Dr. Contreras, the board has already voted on. We currently have standing metrics. This meeting was to change and adjust those metrics in spite of what's happening to reopen. We will still keep the baseline metrics as a guideline until the board decides, otherwise, the new board decides otherwise.
Then I have to make a substitute motion.
Oh, we're in the middle, we're getting ready to vote on this.
In the middle of voting, you can't right now.
And still have the voluntary pre-K, or would that continue?
Mr. Gladden.
She's saying is the students that are in person now, whatever's going on in person now, will that continue based on your motion?
With that, I'm conflicted, and that's my issue with Winston's motion about just removing 3 through 5. But when we have our pre-K and through second teachers, out there, we're creating an issue. It should be closed, period. The fact that Governor Cooper, for whatever political reason, has not called it and left schools exempt, it's left us to do the hard work. I feel that with cases on the rise and what we've already quarantined experienced, we need to close school across the board until January 7th.
Okay, so Diane,
In
he's
spite
saying
of the
for sake
governor's
this
warning.
motion, so after this information, we need to vote. So he's saying that, so that would discontinue under your motion.
Right, I'm not going to bifurcate our K through second over any other grade.
All right, so we're getting ready to vote. All right, so I'll go this way. Linda?
No.
Pat? And Arlene? Karen?
Yes.
No.
Diane?
Yes.
Once again, 6.
Yes, so now we're back to Winston's motion.
Right.
All right, so no more discussion. Kim, everybody clear about Winston's motion?
Are you
Okay,
open to a
Winston's
friendly amendment?
motion is to,
Move to K2 as recommended by the administration, K2 EC and CNA students as recommended by the administration, and to begin the schedule with 312 in January.
Would you be open to a friendly amendment, Winston, on your motion?
okay, we're going to vote then.
That's a no. Thank you for responding.
Kim?
Oh.
Aaron?
No.
No.
Yes.
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 Winston, yes.
Diane?
No.
Four. K not clear.
Oh, I know. I'm sorry.
First this way.
No. Yes. I mean, I was going to vote no. I think we should just stay the way that we are right now, not taking any kids out, not adding any. But I do think because of the legalities with our EC students, that is beyond just a safety health issue, that there are other complications to that. And then CNA is just a specific activity, them being, that passes by a vote of 5-4.
Thank you to all the board members for their thoughtful consideration. I'd like to remind parents of pre-K, K1 and 2, first starting with pre-K and K students, that school will return on Thursday full-time. We'll be adding first and second grade, including the self-contained first and second grade, on Thursday as well full-time. We continue to recommend, even though we have buses running, that parents drive students to reduce the number of students on buses. However, your bus routes are available, and principals have sent out the bus routes to parents. Again, we continue to emphasize that we have health and safety protocols in place, but there should be no expectation that there will not be cases of COVID in schools. And we'll continue to review those protocols with parents and students as we begin the gradual return. The other students on the memo, which are the students in self-contained EC classes in grades 3 through 8, and the students in public separate are expected to return the following Monday, November 16th, and we'll be contacting the students in the CNA classes across the district. We're speaking specifically of the seniors, of which we believe there are 46 who need a practicum experience in order to receive licensure for graduation. So you should expect to hear from your school principals, those students in the CNA program. Thank you.
Adina, I'd like to make,
Hold on for 1 minute, guys, just to clarify, and I know it's what Winston meant when she said EC students, but obviously that included public separate students going back, just in case there are public separate students who are served 504 instead of EC. You meant those as well. I just wanted to make sure that everybody's clear on that.
91 it's all students in adapted curriculum classes, of which some parents know that as self-contained. There are 91 across the district, and the 4 public separate schools.
How about OCS students? Would that include, is that inclusive of OCS students or no?
Which?
No. She's saying no. Okay. Thank you for that clarifying.
no, I'd like to make a motion that instead of going back on Thursday, they go back on Monday. It's not that much difference, but many parents have asked, and the teachers, because there's no school tomorrow, and then the following day, Thursday, is when everyone's supposed to return.
I think at this point that can cause confusion, because notification was sent to parents that in anticipation of a board vote, please be prepared for Thursday. So I think that without there being a school day tomorrow, for principals to clarify, that will add confusion to our parents, for our parents.
And it is a short amount of time to get communication to parents.
There's no school.
Right. That's true.
Madam Chair,
Yes.
I was asked to hold this procedural question, so can I ask it now?
Sure.
Okay, the question is, when you do have a positive case in a school, who all is supposed to be let know? I'm not talking about the specific of who it is, but if it's, say, in the kindergarten class,
Dr. Carr.
then do all of the staff at least need to know that it's been identified, it's been contained, but it is in the building and we want you to, continue to practice? Or is it supposed to be just those folks who are directly affected?
We want to make sure if someone in school is suspected of having COVID, is that what you're saying?
No, what I'm asking is who in your procedures need to know? So you have a case that's been identified positive. Let's just say, for argument's sake, it's a kindergarten class. So you close down the kindergarten class and that hall to do your cleaning or whatever. But do the other staff members who are in the other parts of the building, do they have a right to know that there has been a case? Not specifically who it is, but just so that they are aware that there has been a case notified or identified in that building.
Well, we have a data dashboard that tells everybody there's a case in the building.
There's no responsibility on the part of the principal or anyone to let the rest of the staff know?
The protocol calls for several different steps. So And just again, a reminder that contact tracing is a private and confidential process. So, and that confirmation often comes later than the rumors going around a school. But in general, our plan doesn't call for notifying everybody in the school every time there's an individual case. It does plan for putting information on the data dashboard that anyone can check at any time. The contact tracers and the principals/supervisors will notify anybody who has been identified as a close contact. Public health will follow up with them and give them the additional information that they need. So there should be comfort in knowing that if you have not been identified as a close contact, you're not considered at risk of exposure to COVID based on that, and you're not being asked to quarantine. If there is a cluster, which would be 5 or more epidemiologically linked cases, there will be a notice that would go to the entire school at that point. And that's the process that we've laid out from the beginning, following guidance that's very similar across the state and as well as nationally.
Are these procedures explained to staff?
They've been posted on the website since early in August. We asked every principal to go over them. We have an additional communication because we are getting questions around this, as obviously, school board members are as well. So we've developed a flyer that just, while this information isn't a protocol that's been available for some time, we have an additional communication that will be going out to try to help break this down even more clearly for people. So yes, it's been shared, but like with many things and new information, it has to be shared multiple times before it begins to stick and people understand the different steps in the process.
I have a suggestion, Dr. Carr, and I'll talk to you about it offline.
Okay, that would be great. And we will forward the additional two-pager that sort of takes it step by step by step, trying to make it even more clear that we're going to be sharing with all employees following tonight's vote and information. So we'll forward that to you so you all have it as well to refer to.
You done, Diane?
Yes, thank you.
Byron?
I'd like to make the motion that they start back on Monday, and that pre-K through second parents be offered a choice to either leave their children the whole day or take them half a day. That helps.
Every day?
For them to have the choice. If every piece of instruction helps, there may be parents who want their children to go back to school, but they may not be comfortable leaving them the entire day. Are we not already providing that choice?
Can't run buses like that. Logistically, we can't
run buses like that. Then I'll amend that part and just to start on Monday, because I'm not getting a consensus. I have asked for data and records about supplies that has not been provided to me. I feel we need at least a week to double check that teachers have what they need starting on Monday. And the district has been confused before. We've had to send out notifications and change conference calls and press releases. They will adjust, but I believe parents need to start on Monday, and staff.
So is there a second for your motion?
Did.
Okay, so I don't think, Byron, if this is Tuesday, we're out on Wednesday, that in one day the mail doesn't run. Information about this change, I think, is less than a week. And I just think we'd have half there and half not there. And since we already have such a short window trying to get as much instruction in, I mean, I hear you and Darlene about starting clean on Monday, but I just don't think logistically that we, I would just say if there's a school that you know that doesn't have supplies and resources, then just let the district know.
I agree with that point, but had you voted no, then we would have had to make some adjustments as well. So we were prepared to notify them either way, Madam Chair.
I understand.
So then I would say then have a notice of, of Monday. I understand that they've been prepped and it's gone out that it's a possible, but had the vote been no, they would have had to adjust childcare and everything else to allow teachers, because our teachers are also parents. They have to, adjust, and with that break and schedule, I just feel everyone will be better prepared to start at the beginning of the week, but it's the will of the board.
Comment.
Darlene and Kim.
Since he brought up supplies and things, I want to mention something that I saw today at a school. And they have these hand sanitizer components or whatever, and they're attached to the wall, but there's no hand sanitizer in them. Now, they do have hand sanitizer in other things, but why did we spend the money to buy those and just have them hanging on the wall empty? It makes me wonder how many other.
I don't know. It's just like you can have a dispenser there, and you start to put the refills in as you get more traffic in. I mean, I don't know, but
I don't think they said they never did get filled.
Yeah. Well, I mean, I don't know. We're not back to sort of capacity. And so, I don't know, putting them there, if they would evaporate, if people would just use them because they're there, and if we're going to have them there so that we can put the refills in when we have a larger volume of students there, it makes sense to me with that. But I don't know. The district can probably answer that.
Again, the most helpful thing would be to know specific schools, because sometimes there's a discrepancy. We look at our delivery sheets and know that that certain supplies have been delivered. Sometimes we know who signed for it, but we don't know where they stored it and what they did with it once they got there. One of the questions we are asking is, do you have your hand sanitizer, and are your stations, have they been filled? So if that did not occur at a school, the most helpful thing would be to know, and we will get that corrected immediately.
Byron, Diane wants some clarity on the motion. Can you restate it? You're just wanting students to go back to school on Monday.
No.
Oh, I'm sorry.
No. People, because there was technical difficulty, folks are asking that the motion that passed, if you could just restate it so that there's clarity about the original motion, not the one that you're getting ready to do now.
Okay, the motion that passed, it was Winston's motion, right? Right. So that's pre-K, EC, and CNA. Can you say that again, Dr. Contreras?
I think the audio is cutting out during so a lot of people don't know.
Okay.
Yes, they can't hear it.
That students in pre-K, kindergarten, first and second grade, full day for all full 4 grade levels, including pre-K through second grade students served in self-contained exceptional children classrooms and in in self-contained, would begin on November 12th. On November 16th, all students served in self-contained grades 3-12, the students in public separate, the students in self-contained specialized programs, Building Futures, Crossroads, and Mel Burton, the students in regional behavior support classes, and seniors enrolled in semester-long nursing fundamentals with practicum course will begin obtaining their 40 clinical practicum hours for eligibility. And on January 5th, students in grades 3, 4, and 5. On January 7th, students in 6th grade. January 11th, students in 7th and 8th grade. And January 20th, students in 9th, 10th, and 11th grade.
Anything else, Diane? Right, so now we have Byron's motion. Let's start with you, Linda.
I had a comment.
Oh, I'm sorry, Kim. Into your mic.
Oh, right. I was just going to say that we already prepared families for November 12th in our last meeting. And that's the date everyone was prepared for. And we just can't keep changing dates like this on people. And those of us, unfortunately, that don't have kids in the system, please be considerate of those that have kids in the system and what we've already said to them. That's all.
All right, Linda?
Well, I have
Questions about his motion? You're talking your mic, because
I don't have a question about Byron's. I had questions about other issues before he made that motion. So I'll wait until after the motion.
It's not going to affect you voting. Okay, so how do you vote on Byron's motion?
Madam Chair.
We're in the middle of a vote, Diane? Linda?
Yeah.
Pat? Anita?
No.
Darlene?
Yes.
Byron?
Yes.
No.
Winston?
No.
Ann?
No.
And Dina, no. So it fails by a vote of 7-2. Okay, Linda? And then Diane, I'll come back to you.
I want to go back to the PPE. Again, you know, we continue to hear concerns. And we have one line number.
I'm talking to you, Mike.
All right, sorry, and I'm guilty. But the PPE continues to get raised, whether, now, granted, it may be that the principals have all this stuff and they're just not putting it out because they don't have students in the building. So, you know, I'm not going to say that's not the case, but I do believe there should be one line to call, and I'm going to say it, teachers are going to be afraid of repercussions of saying anything.
They're happening.
Okay, so, you know, it needs to be where they feel safe to make their comments to one situation, and, you know, let someone, there may be, it may be credible concerns, it may be just a communication concern, but, you know, when we were doing the child care thing for the hospitals, we had a situation where something came up, and, you know, I made clear with Mr. Walden that we needed to know why what was said. And going in there and, you know, being ugly about it or whatever, you need to let people know that you want to hear, and it's and we just need to listen, and we need to just simply tell them in a nice manner, here it is, or if it's not there, we need to correct it. Because we need to know that as a district, if PPE is not being appropriately allocated or people feel that they don't have what they need, it shouldn't be a repercussion. It should be simply, call us, it's okay, and we're going to check with your principal, or we're going to check, and we're going to get it fixed. We're going to get it fixed, people. Okay, that's the message we need to send out. So I want to make that clear.
Just to say, we do have a mechanism. They can place it in Let's Talk anonymously, as long as they say the school and they're specific about the issue. So if they say it's Claxton Elementary, we don't have PP&E, that's not specific enough. But if they say Claxton Elementary, they never have to put in a name. The system allows you to place it anonymously. They just need to give us enough information so we can follow through. That will help us to respond to these
Should they just put in this, is there a subject matter? Or a subject, or is it just a comment? Can they say PPE in a subject matter?
Yes.
All right.
We answer these already. Many teachers put their names in, but anyone can place a Let's Talk complaint or comment anonymously, and many people do. So they can go right into the system, but we do need to know something specific so that we
don't have masks.
Right.
You know, we don't have hand sanitizer in our bathrooms. Our building is not being cleaned appropriately. We need to know that. So I want to make sure that teachers and administrators feel safe to put that in somewhere, and, you know, us answer those as appropriately as we can, and make sure that that, because we need to know that. We need to make sure that we're doing the PPE correctly.
Not being negative to teachers who report it, because I've
Exactly.
seen that in writing.
Right. I got an email about staff being cut at schools, and I think this is a communication concern, because as what people don't understand, as our enrollment in face-to-face, because what you base these numbers on were the numbers of face-to-face children, I'm going to assume, and the remote learning at the school, because you would still have to have a teacher there.
Right.
So if they're losing staff, it's because some students have either left the district, homeschooling, or went to the virtual academy, correct?
Yes, or it could be that even in their remote classes, it's not enough for a full teacher, but there are very few classes like this across the district. In fact, we've added 25 teachers. So this, there are very few classes where we had this situation, or very few schools. Out of the 16, I think we had 1,615 elementary teachers. And it was a very small number, but we ended up adding 25 additional teachers to reduce the number of cuts we had to make and to reduce the need for the use of TAs in classrooms. Remember, we were going to split the classrooms for social distancing and use TAs. We're now using teachers across the board for that.
All right, so there won't, so all children will be in front of a teacher even with the classes split?
Correct.
Okay. Are teachers having to do in-person learning and remote learning? Or did the remote option correct that, or not?
With the remote option, we have out of the 1,615 classes, there are 44 sections where the teacher may have up to 5 students who they are teaching with the swivel, who are remote, and that was to keep the students from having to leave their school and go to a virtual academy. So if we didn't do that, we wouldn't have had enough teachers because it was a number like 5.
Okay, but the swivel technology, they're actually seeing the classroom live, correct?
Correct. So they're able to remain at their school and not have to leave to go to the virtual academy.
Is that really teaching virtual if they're actually seeing it live? I mean...
Yeah, because they're virtual. They're not live.
I'm talking about, my question is extra work for the teacher. That's my question, because if, I know my son's in law school, and they teach, he goes in person. However, if for whatever reason...
Yes, it's one of the reasons we didn't want to promote a model to have teachers doing both. Most districts are doing that, having teachers do 2 things. We only have 44, and the teachers at every school, they asked the teacher at the grade level which teacher wanted to do this model.
Okay, but the swivel is the child is on when the classroom is all day active, correct?
Correct.
All right, so the teacher's doing one lesson plan for everyone. The 5 students that are over here are simply watching it on their computer, but whatever assignments she's making, they'll see and be able to get off the...
Right, it's not what we had before the swivel, where teachers were trying to, like I went to one classroom, I know you visited as well, and the TA was literally trying to follow the teacher around with the camera. The swivels are now arriving or have arrived, the 44 arrived, where they can actually watch the instruction and the teacher doesn't have to do something extra.
Right, so, but the remote learning for those students will be whatever the 5 or 6 students that do not want to come to in-person basically will watch it all day and take lunch breaks and all that as all the other children do. Is that correct?
That's correct. And just to clarify, we're redistributing some swivels that were initially delivered to middle schools to cover those 44 elementary classrooms is the priority. We're expecting another shipment the third week of this month that will then fill what we took from middle schools to make sure that everybody has what they need.
Question of specials teachers has come up, and I know we've talked about that a little bit. But, you know, their exposure is larger. So are they going to have all this, maybe they need all the special mask, the outfit, the visor, and all that stuff to make sure that they are overly protected?
We can certainly give that equipment to those teachers. As I've shared with you, in the different schools, there have been different feelings about how to proceed with that. There have been arts teachers, specialist teachers who want to teach all of the students.
Okay.
And there have been others who feel they want their class streamed, and we're dealing with that on a school-by-school basis.
And I'm glad that we're thinking through that and given some options there.
I would just point out that the additional PPE is really designed for the places where kids can't control how they're, you know, coughing or spitting
It was just a
and things
suggestion.
like that.
It's not necessarily a solution. It was a suggestion, and as long as we're thinking, I want to bring attention to those individuals and make sure that we're thinking through all our options to assist them and being as safe as they can be. I had another email about all the testing that we're doing. It seems like we're doing a tremendous amount of testing when maybe we should be just focused on reading, writing, and arithmetic at this point to try and get kids up to speed. You know, with iStation, GCS interims, the NWEA-MAP testing, there's just the New Worlds, the Fast Bridge, because, you know, it's all associated with that. I don't even know what BOG is, B-O-G. What is BOG?
Beginning of grade test.
So, you know, you're using a lot of, I understand trying to get where kids are, but maybe we need to, it's a lot of testing, and the manpower and the energy and everything associated with all those tests isn't leaving a lot of, you know, I'm just wondering if we need to do all that right now. I mean, we've got, maybe we need one test to try to see where we're at instead of doing all of this and all the manpower to do all that. I also got a complaint about, you know, they're having professional development every week, almost.
I mean, I've been.
Come on.
No, I'm just going to say.
I just
Hold on.
I just want to say,
There is a balance to everything, all right? There's a balance to everything. And I just feel that our teachers are already inundated, and there again, I'm just bringing it up.
Agenda.
Beg your pardon?
She had a question before the motion.
I thought it still should be relevant to the agenda and the motion, not.
We already voted on all the motions. We voted on all the motions.
I think it's relevant to the discussion of what's happening with the kids who are in school. I wouldn't deny any board member the opportunity to ask questions at a board meeting about the learning and the instruction and the operations that's going on.
I'm just saying, there's a lot going on, and teachers are feeling, you know, stressed, and I'm just bringing up what they said. So there is a lot of testing going on. They're like, which is taken away from instructional time, which we're saying we need. And I even said sometime before, if we brought them back, especially in January, I didn't want all that time spent on testing. These kids just need some instruction for a while. They just need some instruction. So, I mean, that's my point of view, and it doesn't matter, and you don't have to do anything with it. You know, it's, you know, I went to a, I did the North Carolina School Board event. legislative or whatever it was. And I did watch the board and superintendent and how to get a more concise board. And one of the things they said is all board members should be able to be candid about their views, whether anybody accepts it, likes it, it's fine. You need to be able to, as I'm saying with teachers or anybody, it's not a criticism as much as just voicing, this is what I'm hearing, this is how I'm feeling, and sometimes just letting people vent their or provide information, whether you utilize it or not. There is nothing wrong with that. You can be candid. Whether I agree with anybody on this board or disagree, they should be able to candidly say what they're thinking. And what you do with that information is totally up to the district. I'm just providing it.
I just had a question about the number of students that the motion included. Like, there's 40 students that are part of the CNA, is that correct? How many students between pre-K, the EC, and the CNA? What's the total number of students that will be returning based on the motion that was passed? You can take a minute to get it.
How many students?
Because I'm just thinking.
There are about 5,500 students per grade level. About 46 students in the CNA program. How many students in public separate? Dr. Safra. Well, Dr. Safra will give us the exact numbers of pre-K, K1, 2, and the 4.
But is the question only about those coming in person or just enrollment in general?
Based on the motion tonight, how many, because the motion was a real departure from the number of students that the superintendent's motion included.
We'll follow up with that information.
Okay, that's fine.
Actually, I do have that number. For face-to-face?
Just what was included in the motion
So
tonight.
I don't have pre-K, but for kindergarten, it's 3,204 students. First grade is 3,293. Grade 2 is 3,284.
Mic went out.
I don't have the pre-K face-to-face.
Wouldn't the difference be about 15 to 16,000 students because 20,000, third, fourth, fifth, and sixth graders would be not going back to school until January. So it's, I think, roughly 20,000 fewer students, 22,000 maybe, depending on the exact number of kids in the third, fourth, fifth, and sixth grade. Those are the ones we were delaying.
Yeah, so minus that from what the projection was.
No, sixth grade was already delayed till January.
Yeah.
Yes, they were.
It was 3 through 5 on November 16th, and then December.
Oh, that's right.
Okay, so then it's
We
the
don't have to
15,000. Yeah,
speculate.
the
We have
15,000.
numbers. Kindergarten is 3,204. 3,204. First grade is 3,293. Second grade is 3,284. And I can tell you, I don't have the face-to-face numbers for pre-K or for the public separates, but we can tell you the maximum number it would be for the public separates and for the pre-Ks, if you just give us a moment.
Okay. That's helpful.
I have a question, Madam Chair, as it relates to, I know we have the agenda, but Vice Chair Wellborn raised the question about the instruction. It's my understanding that pre-K, there is not a virtual option. It has to be done in person, and I thought we had stated that teachers would not be doing simultaneous virtual and in person, that those who chose virtual would have a virtual teacher teach them, and those that chose in person would do in person.
So by regulations, we must have a virtual option for pre-K, so that's not accurate.
Okay, well, so then I can forward this parent that said that her child she has to send her child every day in person. She was told at the school level there was not a virtual option for her pre-K.
That's not correct.
Oh, so I'm saying I need to forward it to, okay, so I'll get that to Dr. Oakley. And about doing the teaching, because I was at a poll with students from Bishop High School, at least a private school, Bishop, and they were saying the simultaneous option of a teacher doing virtual and in person at the same time was horrible, because if you were virtual, the teacher didn't see any questions because they were answering questions. In person got more attention than on the screen because the teacher wasn't able to always go back and forth. So is that what we're doing? Because it's not what we stated, that those who remain in the virtual academy would have a virtual teacher to teach, and those in person would have the teacher that's in person.
Right, and then the board asked for the remote option in the schools.
Okay, so that's what made the change.
That's what drove this. So to keep that, you needed 44 sections with a swivel to offer that. So we could do it in every place except where there was a handful of students at a class. Now, those parents still can say, we want virtual academy. The other thing is most of these schools also don't have swivel technology, which is a little bit different than what we initially had with teachers sitting with a laptop trying to walk around and follow students around and show the student at home the class. A swivel is a robot, so it's literally capturing everything in the classroom. It's not ideal, but the parent doesn't have to do that. And we had, before the pandemic, teachers who were very well trained in the swivel. So they had choices about which teacher. In most schools, it's probably one teacher that will use the swivel, or maybe two, and it's the teachers that are most trained to do it.
Is Let's Talk as is, since Linda raised that as well, set up for teachers to, report that? I haven't used Let's Talk in a minute, but are they, is it set up to where they can still put in their information relative to school and use that? Because there's a concern that it tracks your email. Again, the concern about, attitudes or repercussions or your about bullying at whatever local level.
We've had hundreds and hundreds of Let's Talk from teachers, and it doesn't track anyone's email.
Okay. And then if TAs are covering full classes, is that something that you need to be made aware of, or Dr. Oakley's department? Because you had mentioned that TAs are not covering classes, that teachers are.
No, as we move forward,
Okay.
They were covering classes.
They were, so moving forward, it will
We've
just be
just
teachers.
added these additional positions. So we still have to hire about 20 of the teachers, but now with the third graders not coming back until January, that even gives us a little more time.
Okay, and I just want a message to follow up. I guess I'll be the Let's Talk to please check on supplies for Reedy Fork and Gillespie, because I'm getting reports they're out. So I don't know, that could already be in a process.
You said that they are out.
Out of supplies. So that could be a message waiting in an email from staff there. I don't know, but I will just do a Let's Talk for those schools.
Gillespie Park isn't, because I was the person who went and checked on their supplies.
Okay.
That was my school, so I was there.
Okay, so then I'll just message to, they needed to see Principal Lee, who's awesome. Thank you.
Thank you. We have, the last thing on the agenda is the vote tonight to add the superintendent's, waiving the board policy and authorizing the superintendent to implement the appropriate responses. Thank you, Dr. Asaya Sarfo.
I made that motion or added it, so if you want me to.
I would, thank you for letting.
Basically, when we made that in March, I explicitly remember asking for reports on anything that was outside a policy that we were doing, and I don't believe we've received any reports. The other issue I have is open-ended. There's nothing in there to say at said point this is good for a certain amount of time, or that we still need it. So, and I have a concern if I haven't had any reports, which I explicitly remember talking to Angie Henry about getting reports about any things where we are doing things outside the scope of policy for COVID needs, that we would get a report occasionally on what that is or what has happened. So, one thing I would say is, since we haven't gotten any reports, I can either assume we haven't done anything outside of scope of the current policy for COVID, or I can assume we have and I haven't gotten any reporting on it. So, because if we haven't gotten any reporting on it, and like I said, I'm sure I can go back and watch that video, because I remember having a pretty in-depth discussion with Angie about getting reports before I voted for that. And I'm going on 7 months, 8 months, and I have yet to see one report. So there's two ways I can assume that. I can assume that we don't need this authority because we're not going out of we're not going out of scope of board policy, or I can assume that the board's not being updated. And therefore, I'm having a real problem, and I also have a problem with the fact that there's no way to really end it, hardly. I mean, there's not a date in it. There's not a review of, okay, we still need this, and we're going to review it on such date and decide whether it's still needed and vote appropriately. So that's where I'm at with this, is that as a board, I don't feel that I'm being informed of how that authority has been utilized. Does not mean it's being utilized wrong. It doesn't mean anything. It means I'm, as a board, do not know how that authority is being utilized. And I did remember asking very, and I know things get forgotten. And so, that's the reason I'm here. So I don't know if any other board members have comments on this, but, I'm not getting any reports. And if I'm not getting any reports on how the authority is being utilized outside the scope of policy, then I'm going to assume I don't need the authority to do that. I mean,
before we go too far down this, why don't we answer the question? We haven't used it once. That's why you don't have any reports. Not one time have we used the authority. Now, I also want to remind us, we haven't gone back to school yet. So for emergencies, emergencies might arise, but not one time have we used the authority, and had we had to, we would have given you the report.
So we put it in place to allow you to make decisions without having to poll everyone, if I remember correctly, or not having to have approval from everyone. It's been 8 months, 9 months, and we haven't needed it. The superintendent has always had the authority to send kids to school or keep them home, if you remember our many lengthy calendar discussions surrounding that very issue. Once we approve a calendar, then it becomes the superintendent's purview to make adjustments to that calendar as needed. Now, tonight has been an example of where she has brought it to us for us to make the decision on whether we go back to school or not. It was certainly her purview to carry on without this lengthy meeting that we have had tonight. She could have done that.
That's not accurate. That is not accurate. You set metrics, so I could send kids back to school in accordance with your metrics.
Okay, I agree. You're correct.
Thank you.
But prior to us setting the metrics, you could have.
I agree with.
Yes, that was certainly her purview. So if we haven't needed it in 8, 9 months, with all the things that have gone on, the ups, the downs, the we're going, we're not going, the ins and outs and all of that, I would agree with Linda that it either needs a sunset clause or it needs to, the power needs to be revoked. That's just my opinion.
Any other comments?
Madam Chair?
Hold on, Diane, it's Pat, and then you, and then Byron, and Kim.
a motion, or?
You got to talk into your mic.
I just was clarifying if there was a
Okay, so there's not a
or-
motion right now.
There's not a motion, it's a discussion at this point, of which I would assume there's either not going to be a motion, there will be a motion, or there'll be a variation of a motion.
All right, so Pat, do you have any, you don't have anything to say, you were just clarifying that? Okay, Diane?
Okay, Madam Superintendent, are you not still sending the board the BOE bulletin?
Yes, but board members have indicated that it was overwhelming for them to read, so we send it less frequently.
We have one tonight.
Okay, well, I mean, because my thing is that you've made, more than enough attempts to try to make sure that you kept the board informed. So for it to be said that you haven't, even though we specifically talked about the pandemic, but you have still, I mean, I'm looking at your last 3 BOE bulletins. You sent us 2 in September and 1 in October. No, two in October. So I think that for folks to say that they're not being kept abreast of what's going on, that's not true. And I mean, I don't know who's overwhelmed by reading them, but I think that if you take your time, you can read the things. Then the other part of my question is that, okay, we've got a tropical depression that's headed this way. And so you're going to have to make a decision, as you did a few weeks ago, as to whether or not school will operate or not, which is under the normal kinds of things that you would do. But I think that we need to be very careful, particularly to try to sundown the authority we're giving you. Is like, okay, if we decided that we know when this pandemic will be over with, which I don't think we do. And in fact, if there ever was a time to have where you need some additional support, it would be going into this next phase of seeing what's going to happen with bringing the children back, that you're bringing back, what the effects of that is. And I don't think that we need to tie the superintendent's hand to have to try to get 9 of us to agree or disagree on a decision that she makes, because we've been in this meeting now for 3.5 hours. Our average last 3 meetings have been an average of 5 hours. She doesn't have the kind of time, nor does her staff, to wait for 5 hours to make a decision. So we need to be mindful of, be careful what you ask for, because it could put us in a worse situation in terms of decision making and getting it done in a timely manner.
Thank you, Diane. Byron?
So I would like, because I really haven't heard, and I really haven't heard anything to continue to have something that has not been used. I know it was tabled, and I was the deciding vote in tabling it 2 meetings ago, and there was no follow-up or response from, the board chair, the superintendent. I have to disagree with board member Bellamy Smalls about not being informed or updated. We don't talk, Diane, so, I mean, I wouldn't do a blanket statement with that. I know there have been things that I've asked for. There were things I was told at the last board meeting that I could review that I still haven't received, and that I've requested more than once that still hasn't happened. It is what it is. This is now pretty much, my last full meeting. But to the superintendent's point, it has not been used. Every major decision regarding metrics, this is not about, for me, I'm trying to find the reason justification that is not within personality, but what makes sense. If the board has to make the call and the decision, and we're still acting as the board, then we need to act and govern as the board, because to have a surrogate with the same powers that we have, and then we're called to take whatever political hit or change, we could have just voted on the metrics based on the motion in March and been done with it. Change the metrics based on that motion. The superintendent would have been able to, as she stated, to open. She could not open because the metrics and the numbers have changed. She needed new metrics to operate and govern. It was just that change. So what I'm needing to understand is, if the board is called upon every time to make the decision, to take the hit, to do the meetings in the process, then at this time, is it still appropriate to extend that power? It has not as been collaborative this year as I would have hoped it would have been. I have over a dozen emails that have no replies. So and I'm still called to make these hard decisions and debate and mitigate constituents' concerns and everything else, and I've given someone my power to do that and make those decisions. So I need to hear from someone who is against the motion, or to hear as to why is at this point in time it's still relevant, and I haven't heard that yet. So can someone answer that for me? Because if I don't hear anything, then I mean, it's not relevant. To me, it's not relevant whether it continues or whether it stopped, and then the new board can re-extend or do whatever they need to do. I'm just not hearing actual reason, you know, not rooted in personality. I'm looking at the process and what I've been applied to do. If I give somebody keys to drive my car and I have to continue to drive my car, then I need my keys back.
I'm switching to go on the phone. I'm sorry to interrupt, but I have to go get my insulin. I forgot to bring it. I passed for a shot. But I'm dialing in on the phone, so I'm still present. Thank you. Pardon me.
Thank you, Winston. Kim?
Okay, I just wanted to be clear on what Linda's motion was, because we gave authority in regard to spending. Am I correct? Is that what you're referencing?
I'll read the motion that was given. The Board of Education, at its March 13, 2020 emergency meeting, gave authority to the superintendent temporarily waive the board's policies as necessary to implement appropriate response measures regarding potential risks and legal actions associated with COVID-19 pandemic, and require adherence to all board policies effective September 25th. So basically what we said is we have board policies, but due to COVID, the superintendent can ignore certain policies to fulfill issues for COVID-19. And when we did that, I explicitly had a long discussion with, before I gave that to someone, stating I wanted reports on what was being done outside of policy, whether that be a spending issue, whether that be we changed something. It didn't have to be a financial thing. It could be anything. And that we would get a report of any actions taken outside of board policy as a necessity to support COVID. That's what it was. Now, what I'm saying is I haven't received any reports. So therefore, I can assume one of two things. And as stated, what I was told is that that authority has not been utilized. So then the question becomes, why do we continue with that? Because there's a lot of people out there thinking, well, me personally, it's been 8 months. And if we haven't utilized it in 8 months, then I'm questioning if we need to re-implement it at some point, then we can re-implement it. But at this point, I'm not seeing a use, it's been utilized, and I haven't seen any data to say it's been needed. So therefore, I'm saying I'm going to move that we rescind it, at least until you get the new board. But this board's the one that voted for it, okay? So you could then, when you get a new board, if it's needed, you would put it forth before that new board.
You have explained it, but I do remember in context, it had a lot to do with the ability to be able to purchase when we were having this whole, discussion around making that motion. So I'm concerned that if we do something like that, that we're not tying the hands so much of the superintendent, but of the district or Angie's ability to do what she needs to do for whatever may happen during this time. We're adding children on Thursday, so now we're going to have more things in operation and in motion. So I'm not understanding why now, when we're implementing more students returning to school anyway, having that discussion, and COVID is still very relevant.
So, can I ask for Angie to weigh in, Pat, before you? Okay, Angie, are you on the phone?
I am, thank you. I appreciate you giving me this opportunity to speak to this. I think it's important to remember that Member Welborn mentioned the original motion on March 3rd, and school closed. So we didn't have students in school beginning March 6th. So that certainly did change how we had to, or the concerns that we had on how we needed to address decisions that we had to make about how we had to spend money, decisions that would have to be made, you know, on a dime, practically, based on, you know, what was happening in our schools. The board just voted tonight to bring students back starting Thursday. So I have a real concern about how the laws that we put for PPE that is required, that all of our schools have currently, how those things are going to need to be addressed when students come back to school, understanding that our custodial staff is stretched now, may be required as we, you know, as we mentioned earlier tonight, we know that we're going to have some cases where staff and students will test positive, so we need to be able to follow our cleaning protocols and have the resources available to meet those needs. We haven't had to use that yet, again, because we haven't had students in school, but I do believe that we need those that flexibility to make decisions very quickly if we do have the need students come back on Thursday. Also, you know, we continue to have teachers that are doing remote learning. How policies may be having and teachers or staff in quarantine. I think we've got to think about all that as well. How will our staff policies may need to be, how we may need to me, when students back in school, we need to the reason we need flexibility.
Thanks, Angie, if you can.
Sure, and just also, you know, I think every superintendent across the state, I know at least all the large districts across the state have this flexibility, and I don't know that anybody's taken that back from their superintendents yet at this point.
Thank you, Angie. Will you just hang on until we're finished, because some board members might have some questions for you?
Sure.
Pat, and then Byron, then Anita.
Well, that was going to be my question, is across the state and the region, what are other districts still allowing the superintendents this flexibility? And I think Ms. Henry just answered that it sounds like in Wake and our other counties that's still being the case. Is that what I heard, Ms. Henry?
Yes, that's correct. I don't know the case for all 115 school districts, but the larger ones that gave their superintendents this authority back in March have not rescinded it at this point.
I represent a number of the medium and small size districts, and they also have not revoked the authority.
I think my follow-up to that is, you know, maybe there's a sunset, you know, that we talk about, and maybe it's at the 1-year mark. I don't know. I'm just kind of thinking through this and just get all in. So,
Byron, then Anita.
So what I would like to add, and Angie, sometimes my memory gets funny. As really, you made the point
or, the supporting argument about because of the potential cleaning that needs to happen. If I'm not mistaken, the board voted about 2 or 3 months ago for those cleaning contracts that we had to provide a deposit for those cleaning agreements. And so we already have the cleaning companies in place if we have to do a deep cleaning. That was brought to the board, even though based on the motion in March, it was within the superintendent's purview. Is that not correct? We had to do a deposit in order to get those contracts. The board voted. That was on consent agenda for those cleaning companies because of the demand is so high we needed to get in. Am I warm?
So the contracts that you approved were to do the cleaning at specific schools. Those schools where we have struggled to fill vacant custodial positions. In order to be able to continue to clean those schools daily, we have contracted out that cleaning. So I think that there were 3 new schools, or three schools that that the board approved the contract for, and those were contracts for that specific school. Those weren't contracts for us to be able to say, we need you to go to this school tonight or another school sometime to positive test. Right, that we did have cleaning at 3 specific.
But with the explanation for that, and of course, I don't have the wherewithal to pull the video. It was also discussed and stated to board members that, if I recall, that in the event we needed to do a deep cleaning of an entire school, we had entered into an agreement with either a company based in Charlotte or either North Carolina or outside North Carolina that would come in and do a deep clean. It wasn't just for the 3 additional schools. We had a company that was on standby that we would be somewhere, that we would be somewhere down the line to say we could call and we could use those services. So going back to...
That was not a contract that was approved. I think that was just some information that we shared. We don't have a contract because, again, we would have brought to the board any contract, over $150. If we have time to... We've been bringing you contracts where we have time to schedule. Concern is where we something more immediate to very quickly and try to bring people in to the degree that it may exceed the authority have to enter into first contract board approved.
Okay, but there are moments that are qualifying, and then I'm just trying to ascertain what exactly. Sure, there are moments to where in events of crisis, there are decisions that can be made, or at least initiate and negotiate. I remember when we had the hurricane situation. Is that just limited to natural disaster, or does that also include the pandemic where the board voted after the fact and decisions were made and there were no additional powers given?
There are very limited times when you can, it depends on the kinds of contracts. Those really have more to do with the nature of the contract than the board's authority.
Okay. What I'm getting is that the superintendent is conscious of what type of board she works for, that even there are decisions that she may not have to come to the board, she brings it to the board because of past, misunderstandings and et cetera like that. So there is that, I'd rather the board vote on it and then I do it and then it becomes a whole nother thing. Superintendent, do you care to weigh in on your feelings about your need for it? This is what we did at your recommendation. So is it your recommendation now that you no longer leave that power at this time, because we have set the metrics as a board to start next year, and that process, we have school happening, but we also have 150,000 threshold that is already built in that you have the power to do. So this would only be an emergency if we would exceed 150,000, as I'm understanding. What are your thoughts about it?
I would say that during a crisis, and we're still in the midst of a pandemic, you always give your administration as much flexibility as possible, which is why nearly every superintendent in the state has this flexibility. And to my knowledge, not a single board has even contemplated in the middle of a crisis taking that flexibility away. And this district, this administration, of which primarily our COO would be the one to use this authority, it's not abused it, it's not used it yet. Understanding wherever we can, we bring things to the board. This is when things fall in between the board meetings. So I would recommend that, because we're in the middle of a pandemic, we maintain this, and that it can be revisited every few months to see, is this still necessary? But I'm just unsure why we're having this discussion, as though something had, I'm wondering what precipitated this.
Well, from my perspective, in trying to see and understand, it has been, during this entire process, has not necessarily felt as strong of a collaboration as it could have been. And so I think it's about the communication and faith, and I'm not getting to that, I can only speak for me. I have reached out to have collaboration, communication, to do an FYI to check in, and there has not been any response from you as the leader of this district. And I think that came to a head at the last meeting, which was, of course, something that I do regret, and stated so at the last board meeting. However, there's got to be a collaboration between this board and the superintendent. There cannot continue to be, a wall up in terms of people want to be informed. We have constituents that are very empowered, that want to know what's going on, that vote, and we're elected. So our roles in the community are different. So I will say, for me, I have been disappointed at the lack of response and information that I have received about my district, about the needs of my constituents, and about the questions that I have. And I have used every available tool to have contact and conversation, and there has been no response. So this is something that the board did overall to help you, to help us be united and strong and support our district. And when we don't know what's going on, then that's a problem. So I'll speak for me on that.
Okay. Oh, I'm sorry. Who's next?
Anita?
If Angie wants to go ahead, let her. Was that Angie speaking?
That was Linda.
Oh, okay. My constituents feel, in large part, that the board has abandoned our law-given fiduciary responsibility. And they continue to remind me of that almost on a daily basis. We did receive a report about the 35 million COVID, somebody correct me if I'm wrong, $35 million in COVID money that has come into the district. And I think we had spent, Angie, about 25 million of that. Is that correct?
I believe that was right. That was the report as of the end of August.
I think it was.
That we had made expenditures. Now, not all of those expenditures were from the money that we received from the state or the federal government, but yeah. we had approximately that much in expenditures, yes.
Did we not have, because it came from the federal and state government, did we not have a fiduciary responsibility towards that money, in your opinion?
So the responsibility I think that the board has was to budget those dollars, and I think I shared with you that those dollars were budgeted in the last budget amendment that was taken for the 1920 year, because most of those dollars, we knew what those were going to be. And the board now continuing to operate under an interim budget resolution that includes those dollars, because the interim budget resolution states that we're operating under the budget for the 1920 budget year. Those dollars have not been spent in any way that would require board approval, these federal dollars. In fact, lots of items we are following a bid process that is not even, that's more restrictive even than what the board has in place currently to meet the uniform guidance requirements for any kind of federal dollars and any potential dollars that we might get reimbursed from FEMA. So we've been very careful with the dollars that we're spending to be sure that we're following uniform guidance, which, as I mentioned, is more restrictive than what board policy requires.
And explain more restrictive on those dollars.
Sure. So with uniform guidance, it requires bidding and quotes at levels that, again, are lower than what our board has. We have to bid anything that has a cost greater than $10,000. So we've had to issue bids for hand sanitizer, face masks, lots of the PPE items, as well as other things that we've done. It also requires that we bid services, which is not anything that our board requires or the state statute requires. We're not required anywhere other than uniform guidance to bid services. So any service that we're going to have over $10,000, we're required to bid that as well. So those are examples of some of the more restrictive practices that we're having to follow to be in compliance with uniform guidance.
And that applies to both the federal and state dollars that we received?
I'm sorry, I didn't hear that part.
Those restrictions cover both state and federal dollars or just federal dollars?
They're required for federal dollars, but they're also required for any dollars we spend that we're going to file for reimbursement from FEMA. So we're spending, especially a lot of our local dollars, we're spending that we're spending on COVID items. We are using the federal requirements and we're filing for reimbursement from FEMA. That's the reason we're following those. Is in the event that we do get reimbursed, we will have purchased things in the appropriate way.
But FEMA's not involved in the state dollars?
Correct. FEMA is not involved in the state dollars.
The question is, are you following those same procedures for the state dollars that we have received? And was any purchase order or contract in excess of $150,000?
Any contract that has been in excess of $150,000 has been brought to the board.
What about purchase
orders? We've not
orders?
entered in any contract at this point for more than $150,000 that this board has not approved.
What about?
So the state dollars, and I know this may be getting in the weeds a little bit, and so if it is, just tell me and I'll stop. But, lots of these dollars have some flexibility. Lots of the state dollars, we're getting them in kind of little dribbles and small amounts, that we got some in June, and then they say we're going to get more. We haven't gotten the more yet and how much that's going to be. But a lot of things we are still continuing to bid because we may change funding sources. We may think we're going to use federal dollars and intend to use federal dollars to purchase something, and then we get more money from a state allotment that would allow us to use the state money that's required to be bid one way, and then that'll free up some federal dollars that may have a later deadline for something else. So we're trying to be as effective and efficient in using these dollars that are available, knowing that we may use some flexibility to move money between funding sources. As I mentioned in that report that you did receive, we may continue to move expenditures as dollars become available. Lots of these dollars we're getting say that they're effective for expenditures that can go back to March 20th. So for that reason, we're continuing to try to use the bid process fairly consistently to be sure that we have that ability.
Okay, and normal routine, back to my other question, has there been any purchase order written in excess of $150,000?
So I feel certain the answer to that is yes, but I can't think of one right off the top of my head other than potentially some software licenses and perhaps some PPE, some large orders of the hand sanitizer that we've done recently. But I would have to check on that. I don't know the answer to that right off the top of my head.
And so under normal operating procedures, the moving of this money around to take best advantage of how we allocate our dollars, that would normally be in budget amendment. Is that correct? Normally.
It depends on how the dollars were originally budgeted. If we spend them in such a way that they could be reimbursed based on the original budget, it would not require a budget amendment. But if say, we had budgeted them for some kind of technology and then we decided to use it for some kind of instructional supply, that might require a budget amendment. So it really, the answer to that question is really dependent on how the dollars were originally budgeted when we received the money to start with.
I understand that, but shifting our funding sources between state and federal also would create a budget amendment. Is that correct?
Again, that answer is kind of the same. It just depends on how they were originally budgeted, how those dollars were originally budgeted. A budget amendment is only required when we're spending the dollars different than the way we budgeted. So if we budgeted them for instructional supplies and then we decided to transfer some instructional supplies from state to federal, then we wouldn't need a budget amendment in that case.
But you would if the funding source changes. For instance, we bought a lot of PPE, and I'm hearing that the governor is going to send us more money for PPE. So if we have paid for some of that PPE equipment out of federal dollars and the government sends us, the state sends us more dollars, we may switch it over there. Is that
right? And in that case, the board would have to do a budget amendment for the additional dollars the governor gave us. So in that case, yes, we would have to have a budget amendment done there.
We aren't seeing budget amendments. Is there a reason? Have we not needed one, or?
No, we are still operating under the interim budget, which you typically don't amend. Our intent is, quite frankly, I was waiting until we had a fairly good handle on charter school enrollment and the impact that would have on our 2021 budget to bring a final 2021 beginning budget to the board. If you'll recall, last year, I think it was January when the board passed their 1920 budget resolution, and it looks like we may be around that same time frame this year. Kind of partly for the same reason, because the state never did pass the budget. They just passed a couple of mini budgets. And then again, because of the impact the pandemic has had on our enrollment and on potential enrollment in charter schools, I just felt like we needed to have a good handle on that number to be able to make final decisions on our budget. So the reason you haven't seen budget amendments is because we don't have a 2021 budget resolution approved at this point.
Okay, one final question. Dina's busy. Does anybody remember who our North Carolina School Board liaison is?
What do you mean by liaison?
Board member that's a liaison to North Carolina school boards. Don't we normally have one?
Typically, we've had 3 or 4 that are designated when you have the fall conference.
No, I don't think that's what she means. She means who's our representative of this district on the State Board of Education.
Oh, that one. Okay.
And I believe it is Mr. Duncan.
Pardon, Jill?
Alan Duncan?
Alan Duncan.
No, I wasn't talking about Alan. No, I'm talking not the State Board of Education, but the North Carolina School Board Association. We've had liaisons with great city schools, et cetera. Do we not have one?
I don't believe we've ever had what somebody
Okay.
appointed as a liaison. We have on occasion had a member on their board of directors. I don't believe we do currently, but we have.
Thank you.
We have every year had people that are voting members that attend the delegate conference, and that might be what she's referring to.
I know that. That
Okay.
wasn't what I was asking.
All right, I'm going to make a motion.
I'd say something.
Sure.
Well, you can make.
If we want to keep this in place, then I need a modification that a report is required monthly, even if it's to say we have not utilized it, the authority. And also, I need a sundown clause. In other words, which would force it to be reassessed every 4 months or something as to whether it needs to stay in place.
You need to put that in form of a motion.
All right, I moved. Do I have to rescind the original one?
No, you can just
Want to modify the original?
just do a
Make
motion.
one.
Huh?
Never made one.
Well, I know, I'm asking what.
That
what I
motion was
need.
tabled, so you can just read this one and
Any
make the...
motion that you can, if you're asking for reports, you can just do that. That's not pulling that other motion.
Well, I mean, I want it part of the authority that it is required that monthly, we're told whether this authority has been utilized in any format, and I want a sundown clause of 4 months. 4 months that would cause it to lapse and then be reassessed whether we want to renew it. Can I do that? What?
Your motion.
That's my motion. 4 months from today. I'm going to start it as of the first of the month. That's fine, you know?
It would make sense to tie them to the report and a board meeting. Otherwise, you're going to have a week where you have nothing. I mean, don't you want a report?
I want a report, and the report may be, we haven't used it. That may be the report. That may be as simple as it is.
How often do you want the reports? All right, so you move to request that the board receive monthly reports on the exercise of authority that has been waived as a result of the pandemic, and that the board reconsider whether to authorize the report in 4 months. The
Not the
authority
report,
in
the
the
authority.
authority in 4 months. So at the next regular meeting, 4 months from today.
All right.
Or so. 4 months, which would December, January, February, March.
It's in the statement that we definitely
Regular
get the
March
report,
meeting.
or we get an acknowledgement that we haven't used it, and there's a sundown clause that doesn't mean we won't reinitiate it, but
You'll
we get to
reconsider the
motion.
the
Yes. So that it's
authority
just not
in
endless.
the regular March meeting.
Right.
A second?
I'll second.
Just be on the,
Second that, Anita?
Yeah.
Okay. Kim, you had a question?
no, it's saying, couldn't that just be make that part of our,
In the form of a motion, so.
Could.
I'll ask you to vote first, Kim.
Kim, that would cover it.
Right.
Sure.
I'd like it being part of the authority, because then it's directly tied to that. I like the report being there, because then I don't have to go back and say, well, we said we were going to do this. If it's
right,
part
so
of
I'm making it part of our agenda, our monthly
Instead
agenda.
of 4 months, she's wanting proposing monthly.
Right.
I prefer it in the motion.
I don't understand the difference
I'm making a
between-
substitute motion that be part of our regular agenda item. You want a report, that report, monthly,
Instead of 4 months.
instead of waiting.
So that's Kim's motion. Is there
That's
a
my
second to Kim's
substitute motion.
Are you eliminating the,
That's a motion.
That's my motion.
are you eliminating the sunset on it? From your motion?
Yes.
Second for Kim's motion.
You'll know.
So I'll second that, because every meeting is a potential sunset.
Exactly.
It's not just 4 months and then you're having a sunset on that average of 4 months. Every month you're reviewing to see if you still need it. Or am I missing it?
Because she shouldn't be held to that for every month. She needs to know that I'm trying to give a decent amount of time that she can work within, which is 4 months. If you say that I'm going to look at pulling it every month, then I think
If there's nothing, Linda, then you said that's the report.
All right, so we have a motion and it's been seconded.
That's my
so
substitute
let's vote.
sunset and
So
report are
Kim,
two different things.
how do you vote?
Can you restate
Yes.
the motion? This is Winston.
Sure. My substitute motion is that we make that report part of our monthly agenda item, that Angie and Dr. Contreras will report on the usage of the waiver of that authority.
It removes the sunset clause.
What, Winston?
It removes the sunset?
Yes.
Ma'am.
Okay.
All right.
It doesn't remove the sunset. The sunset is part of.
Wait a minute,
Right.
say that again, Kim. What you just said.
Sure. My motion is that we make it part of our monthly agenda. Every time we meet, it's an agenda item, and if there's nothing, that's what will be reported. And if we need the sunset, it was like, okay, just make the motion and do it.
All right, so Kim, how do you vote on your motion?
Does that clarify? No, we're making it agenda item.
Yeah, I get that.
Right.
And I appreciate that part, but there's no sunset in there if it's month to month.
Because
It
at
would
any
be
moment,
part
we can
of
vote
what
to
we
take it away.
discuss. I'm saying it'll be part of what we discuss.
We're going to have this discussion every month.
No, maybe there's
May
nothing to
not.
report every month.
You may not.
All right,
If
Byron?
somebody makes the motion.
Byron?
I just want to offer okay, if I can offer a point of clarification on these motions, because I believe Kim is providing what you want. Based on Linda's stated motion, it will end in 4 months. Jill kind of, gave an unofficial friendly amendment. It would end on a board meeting. If the majority of votes were not there to sunset it, you could not sunset it. The only way sunset would make sense is if you set the date in between board meetings that it would end, and then it would need to be reviewed at the following board meeting. By having it set every month, you all could make a motion by the board's majority to end that power, to rescind that power back, and you were reviewing it monthly. So you would still have to vote. The sunset would only matter because at the next board meeting, it could be completely reversed. What matter is if you timed it to end in between board meetings, that's the only way it would be effective. It would not be effective because then that board at the next meeting would have to review the entire report, and then you'd have to have the majority to rescind.
Can I say something? Can y'all just rescind this? It's not that important to me to go through extra work of putting this on the agenda. If there's an emergency, we can close schools until the next board meeting. So please, rescind it. I don't need an agenda item. I don't want to do extra reports. We're in the midst of a pandemic. We haven't used it one time to ask staff to do this kind of work in the midst of trying to get kids back in school. So please, just rescind it.
I have a motion to have it on the agenda monthly. Kim?
Yes.
Byron? Byron?
I'm not saying?
Huh?
I guess I rescind my second. Is that just out of frustration, or you?
Byron, just vote on it.
All right, vote on it.
Just vote.
It's our agenda.
I'm just trying to, I'm loopy at this point. Monthly agenda, sure.
Darlene?
No.
Anita?
No.
Pat?
No.
Linda?
No.
Diane?
No.
Winston?
No.
No. That fails by a vote of 7 to 2. Now we are back to Linda's motion. All right, so Linda's motion is, can you restate your motion one more time, Linda? Just the motion, not...
The motion is that we get a simple report if the authority has not been used, it is simply, we have not used it. That is not hard. If the authority has been used, as a board, we're entitled to know that. Okay? So it's simply that you will give us, I'm not saying in depth, we spent such and such money for this, you could give it in a list.
What's the motion?
That we get a monthly statement, a report of whether the authority's been used and how, and that there is a sunset clause in there for 4 months that if you know that it's going to set, you simply can do it in the prior meeting just before it sets and say, this is going to set, do we want to continue it? It doesn't have to land on that
Kim's
day.
motion with a sunset.
Yeah.
Okay.
No.
Again, it's not that important.
I know, but it's just our process.
But you
so-
ask, I want you all to understand this. You're voting on something that I am asking you or telling you I don't need. Necessary. Go ahead and vote to rescind it. Please.
Dr. Contreras, in all fairness, it's not about really what you need. It's
You're
what-
asking-
It's what the children need, and that's what we're advocating for.
It's asking me to do extra work for something that's totally unnecessary. Please rescind it.
Was your motion to rescind, Linda?
My motion is to rescind.
Someone would please make a motion to
Okay.
rescind.
Is there a second to that?
I second.
All right, so Linda?
Yes.
Pat?
Yes.
Huh?
Yes.
Ada?
Yes.
Oh, shit. Darlene?
No.
Byron?
I think we need a
Vote, dear.
come back to me or invoke board policy, because I am not clear. This is done with
No.
all types of personality and temperature, and this is
Diane?
this is not effective.
No.
Winston?
No.
Byron, are you going to vote? You have to vote. I got Kim's vote. Byron? Did you vote?
Yes.
All right, so that fails by a vote of 5-4. Okay. All right, so we are now at board comments. And before we do that, I have a question for Dr. Contreras. How many financial accusations have you had to answer? Information. So if this was an independent concern, then I could see the conversation, but it is in the middle of a campaign of mischaracterization of both our chief financial officer and the superintendent. Board members have been on social media talking about, ask her to show you the money. County commissioners have been involved. I believe, wasn't a state legislator involved? Making the request to show some funds, and when the superintendent and the chief financial officer submits the documentation that affirms that there has been no misappropriation, no misuse, no greater use than her predecessors, no one comes back and says there is no pattern of misuse of funds or actions. I'm sorry, I feel this was motivated, and I think it has nothing to do with this issue. I have not abdicated my responsibility to get information and to make decisions at all in this process. As Jill has said, as Angie has said, and as Dr. Contreras has said, this is happening across the country. And there is no pattern, no information that should have led to this kind of a discussion tonight. So I'm sorry, but I just am sorry that that you and our chief financial officer, our independent auditors, all of the people that bring back the records that show the integrity of our finances and financial decisions, because I trust them and I believe them and I support them.
My issue is
We're
we
now at
gave
board comments,
authority
Linda, and
over.
this
Oh,
is
no,
a
you
board
can't
comment.
lecture me.
I'm
and
not lecturing you. I can
that's
make a
exactly
comment
what
if I
you're
want
doing.
to. I can make a comment if I want to.
And I'm going to make mine back.
Well, then make your board comments.
All right, that's fine. I'll go first. Is that
It is, please.
The issue is, as a board, we should be informed, all right? We have gotten no reports. We don't, if you look at the last few board meetings, we get all our information here. I do not feel I'm effective or informed on what's going on in this district, okay? So my thing is I felt that I should have put some caveats into that. Number one, that I would get a report. Number two, that there would be a sunset so that it could be discussed. And also for the new people coming in, that we're not locking them into this without them voting. So now that is me. It had nothing to do with anything else but other than that it was a poor motion and I didn't think to put a sunset. If I would have normally done that, but I didn't think it through because of everything going through. I would put a sunset clause and giving authority to somebody. Number two, reporting is not strong as far as what's going on, nor is communication. That's my personal opinion. So I wanted the report in there to reassure that I would be notified because the communication is not strong. Now, I'm going to move on because that's my last say on that. And I want to say I want to recognize the Veterans Day that's coming up tomorrow. I want to recognize the sacrifices and the honor of these veterans that sacrifice on a regular basis to support our great country, and I want them to know that I appreciate them very much. Thank you.
Thank you. Just another salute to Byron and Darlene Garrett for your record of service and commitment to all of those in our community. I don't think that's ever been in doubt, your passion and commitment to education. So it's off. Happy birthday, Marines. Today, the Marine Corps turns 245 years old. And so if you see a Marine, just say happy birthday, Marine. They'll give you a nod or a wink. Happy Veterans Day, as we celebrate that tomorrow, to all of our vets, past and present. And just wish everybody a happy Thanksgiving. And I hope that we'll start to build and rally support around the decision. I mean, we made a big monumental decision tonight. I know that we don't all 100% agree on the mechanics of that and the timing perhaps, but we've made a decision. I believe in this community. I believe in the goodness of people in this community. I've seen it, and I hope that will that's what will rise to the top, and we can move forward together. Thank you.
Anita?
First thing I want to say is to thank the people for the passage of the bond. It's a first step, a small step, but a first step in trying to get our school buildings and facilities to where they need to be. I, too, want to recognize our vets, Pat, in particular, serving on our board. They keep us free. They keep us able to have these meetings. And then I hate to end on a sour note, but because I ask financial questions, I'm not accusing anyone of anything. The law says I have a duty to ask those questions. It was not put in the law for me to abdicate or ignore. I took my oath of office seriously, and it says I will do that. If you want to take it personal, that's your problem, not mine.
Darlene? Talking to you.
Things I want to bring up that I meant to bring up a little bit earlier. There's been reported to me there's a glitch with the new MacBooks. The teachers aren't able to use their share their screens. So we really need technology to come up with a solution. And overall, I'm hearing technology does a good job. There just aren't enough of them. So more people. COVID dashboard.
Really make sure your light's on the whole time.
COVID dashboard is apparently isn't being updated. I mean, I'm sure it is being updated, but it must be slow because it's showing schools with only one incident when, for example, the one I was talking about tonight has 3. I too want to say thank you to the board, current board members. I've enjoyed working with all of you and all of the ones from previous years too. The one thing I wished I had done is I wished I had started a diary or a journal to keep, because I think I could have written the best book. But anyway, didn't do that. Want to thank all the teachers out there. I know it seems like, you know, you aren't being respected or valued, but you are. Although it doesn't really seem like it. And I just want to encourage board members to go to your schools, because today when I went, they were just like so happy. You would have thought I was some special person. When you go there, they feel valued. And I think, you know, some of us who've been on the board for a long time, we tend to not maybe go as much as we used to. And I just think that is a really, really important, very important thing to do. And then I think lastly, I just want to say, well, congratulations to everyone who won. Pat won a close one, and good job. And I'm really excited about the lady who's taken over my place, Deborah Napper. I've gotten to know her, and she is a nurse. She's a young woman with young children, sort of not, I wasn't that young when I took over, but I think I like that she has young children, because I think when you do have children, you are much more, you know, in touch with the schools. And she already really wants, she's already involved in talking to teachers, and I just think you guys are going to have a really good board member, and it makes me feel good that he's taken my place. I can see he's great knowing all of you and staff. I'm going to miss you. I know you work really hard, and Dr. Contreras, we aren't always on the same page, but I do appreciate, I know you really care about kids, and you work hard. And I decided, you know, I came in thinking I was going to vote to rescind the special powers, but, you know, since you haven't really even used them, I don't see the point of. I wish you all well. I know this is a hard job, and I just hope and pray that we don't. They are very, very.
Byron?
So much I could say. I am excited about Darlene's school board member, Mrs. Napper, Deb Napper. She's, I remember the day she filed. I was there at the Board of Elections, and she was excited. I met her husband, met her kids, and she has really went a long way. I will say about the overall accumulation of everything that has happened this board meeting did not start tonight, and it definitely did not touch the surface of all the underlying issues. I will say that there are no victims sitting at this table, that everyone in their own capacity has contributed to some form of character mischaracterization or assassination, or contributed to some level of something in some capacity. So there are no victims here. It is a process this board has to work together if it's going to stay together, and this district is going to stay together. It has been Young and the Restless mixed with Real Housewives of Atlanta for the past 4 years. It really has been quite dramatic. And again, there are no victims when it comes to that drama. Everyone has participated in this culture. Everyone. And so that is something that I will not miss. I hope whoever comes behind me will be accountable and be present and be independent in thought. Because let me tell you, I know what that costs you. I drove by Gateway today, and it's still standing. And I'm grateful for that. And there was no defense about my character. So that's interesting how certain board members want to pick and choose who to defend. That's interesting. I want to thank board members whose comments were sincere, and I want to thank the board members who had nothing to say, because that was sincere. This has been a journey. You may see me again in another capacity. I hope to roll out my podcast starting in December. Darlene, I'm going to have you on. Milkman Radio, I hope to continue with that. I wish nothing but the absolute best for each and every one of you, regardless of what you've done to me, to my face, behind my back, what you've said, because it's about the kids. This is not about ego. It's about the kids, and some of us have forgotten that. Thank you all. I thank District 7 for allowing me to serve. I will say that people know their school board members more than they know their county commissioners now. Well, that they know their county commissioners now as well. When I started 4 years ago, no one filed to take this seat because the school board was fluttering between irrelevance and just business as usual. And now everyone knows, have extremely high ratings. Actually, and I will have merchandise available. Some people have wanted me to, I will have merchandise available starting in December on some of my, my sayings that some people have found interesting. It has been an interesting journey, and I want to particularly thank board members that whether you agreed with me or disagree with me, you treated me as human, that I was never made to feel ashamed or indifferent because of the color of my skin. I can't say that about every board member, but I will say to the ones that know it matters. As it relates to my character assassination attempt, I want to thank board members Linda Wilborn and Darlene Garrett, who not only called, but came. And we have sparred like titans in this room, and they showed up for me. There are other board members who called and checked on me, not everyone. But if you lost a family member or a relative or something happened, I always called, I emailed, and text. Hope you all continue to do better. Be the leaders that you profess to be. Build your platforms and be consistent when it comes to these children. It shouldn't have taken COVID and all of our children impacted severely for us to realize the inequities in this district, to vote to support initiatives that make sense and to be consistent, because when those children come back, they will still have the gaps and the challenges they had pre-COVID. It is just exacerbated and magnified. And trust and believe your teachers. Continue to be honest with yourselves about race in this country. Regardless of who is the president, after all the legal battles are said and done, we have a substantial issue with race in this country, and COVID has pulled all the sheets away from that. You cannot run from color anymore. You have to deal with it. And how we did tonight is not the best way. We all could have done better, and we should have done better. And I know many of us feel that, you know, tone and things like that happen. We're going to agree to disagree and disagree, but we've got to stop the shots. And Lord knows I used to come trigger happy, and I have evolved from that. And I've evolved from this experience. So you all have taught me, whether you meant to or not, whether you meant to destroy me or not, you've definitely taught me a lesson. You all be blessed, and please do right for kids, because I will be back. I'll be the new Joe. I'll be the new young Joe, always speaking at public comments, because I was an advocate before I started, and I will be one after I leave. Do better, be better. Let's make it about children, not about ego. That's for all of you. Thank you.
All I want to say to Byron, you were elected, and you will always be honorable. Nobody can take that away from you. That's my comment to you. And, you know, the school board is not the be-all, end-all. And it's not always someone's life to be here. You can do great things in the community without serving in this capacity. But so you're always honorable, and nobody can take that away from you. I wanted to report out, celebrate 2 students at Southwest Guilford High School. Michael Mode wins the North Carolina Science Teacher Association, I'm sorry, that's not a student, it's a teacher, excuse me. District 5 Outstanding High School Science Teacher for 2020. And Janice McDonald, Southwest, again, is selected to serve as a NASA NC Space Education Ambassador for 2021, joining a cohort of teachers representing 11 school districts across the state. And I also want to recognize, again, our our Employee of the Month, Ms. Cherry Rodriguez at Vandalia Elementary. Congratulations to you. She is a cafeteria manager for Vandalia Elementary. And, you know, to our parents, we are here for you. We do prioritize your concerns. I do believe that this board can do better, and we will do better. I believe that we can have win-win scenarios, and that we have been put in, you know, a difficult situation that we did not, of course, ask for. And again, we need to continue to be more gracious towards one another. And I'm hoping that, you know, the Guilford County, again, community, we have to decide that we're going to keep each other safe in this pandemic. We have to decide that we are going to physically distance and wear a mask in public, and all of those things that we need to do in order to move the metrics in the right direction, so that every student can come back to school safely, that we want them to come back to. And that this still is an opportunity, I'm going to keep saying it, that it is an opportunity to not do school the same way, because it was not doing what it needed to do for all of the children, so especially Black and brown children. So we definitely have an opportunity. We're going to have to push the envelope, and thank God we're going to get a new Secretary of Education. I'm grateful for that. Goodbye, Betsy DeVos. Thank you.
Thank you, Kim. Pat, thank you for your service. My dad, Command Sergeant Major James Hayes, Sr., and his military career. Thank you both for the sacrifices that you've made defending our country. And Darlene, I know that you are, oh, I'm sorry, Diane. I'll call on you and Winston in just a minute, okay? But Darlene, I know your family means a lot to you, and I am really excited that you're going to spend your time off the board running after 2 grandchildren, at least for now, and excited about that. And Byron, I'm glad to know we'll be hearing more about the stuff that you're doing, and thank you again. And I want to say to Dr. Contreras, because I do support her, unequivocally support her, and the time that our kids are going to have in school, whether it's 16 days or 26 days, is critically important, because Black babies begin to struggle the minute they're conceived. Maternal health for Black women is at an all-time crisis right now. Every day there are stories about well-educated, well-incomed, Gold Star insurance Black women dying in their 20s and in their 30s, not making it out of childbirth. And that's the mothers, because their wombs are so stressed out that they reach the tipping point for delivery before the baby can stay in there 9 months to fully develop. And then we get a lot of those children. And so trying to survive 9 months of incubation is a struggle, and race has everything to do with that. And then there's infant mortality. Black babies in this county are 3 to 4 times greater, their likelihood of dying before their first birthday, the minute they're conceived. And so if they're going to get 26 days of instruction that hopefully will lead to additional months of instruction, it is absolutely worth it to me, because every minute of their life has been a struggle. So when I think about the risk and the sacrifices, It is a much larger picture than what we're just dealing with right now. So I thank you for your love of those children and what you're willing to do and say and what you take from the public and from some of us because of the boldness in which you do that. I appreciate it. Thank you. Winston, and Diane, you can close us out. Winston, are you there?
I'm here, thank you. Darlene, 20 years is a long time in public service, so thank you for that and for continuing the legacy through Michael. I think there was a great race for your seat between Michelle Bardsley and Deborah Napper, and I thought it was a clean race and a good discussion of issues. It was a close race, and so I think Deborah will do well and look forward to welcoming her to the board. I think there was a three-way election for Byron's seat. Betty Jenkins is going to be sitting in that seat, a former school employee and longtime activist and advocate in the community. Look forward to welcoming her. I don't know if Byron remembers, 2 years ago at Bob Page's house, he approached me to apologize for something minor, not a big deal at the time, but I said to him then, Byron, let's just decide that you don't ever have to apologize to me. You're going to do you and I'm going to do me. And, Byron, you've tested me on that commitment that I made. Never tested that. I think you've got a long career ahead of you, and I look forward to seeing where that leads you, how your journey continues. Pat, I thought you and Blake, who are both friends of mine and friends of each other, ran a good, clean campaign talking about issues that matter. And it too was a close race, and I know you and Blake remain friendly. And I just want to say that every single person who ran for office and every single person who volunteered on a campaign, every single person who went out and phone banked and got signatures and knocked on a door for a cause that you care about, and especially one related to kids, thank you. And I hope that if what you see regularly in the Board of Education is either interesting to you or frustrating to you, that will drive you to run and to be involved. I was out on election day and I intersected with advocates from all sides of issues at the polling places where I was. We had good conversation. There was a lot of great energy. There was a teacher at Mendenhall, and now I'm forgetting her name. She's retired. She taught for years and then worked in the media center there, and she was there advocating on the bond. And there were students, people of all ages, from their early 20s into their 40s, who were showing up to vote at Mendenhall, who were so excited to see her there. And she knew their names and had taught them for years and had become a citizen activist. So I just want to thank all of those people. I want to thank the 125 people who through GEA participated in Principal for a Day and went to visit a school, as Darlene says, is so important. That's a form of advocacy. And I want to thank all of our teachers, some of whom I know will be disappointed or angry or fearful about returning to school, others who will be excited, others who will be fearful and show up brave. And I want to thank our principals and curriculum facilitators, all of our staff, our bus drivers, our cafeteria workers. And I certainly want to thank the superintendent because I think she has led during excruciating time. And I think doing a tremendous job under absolutely impossible circumstances. And that she's often recognized nationally in other circles for that, and sometimes that's what happens. Our family beats up on us, and then we go out and our best friend's family or other families think we're sometimes we take the greatest sort of hits at home, but maybe that makes us stronger and better. But I just want to let you know how much the people do. Dina, also appreciate your leadership a great deal. We're not an easy bunch of cats to herd, so thank you, and look forward to continuing the work.
Thank you, Winston. Diane?
Okay, let me just kind of ask that we, focus back on some of the things that we have done And I'd like for the superintendent, sometime between now and maybe the first year, if we can find out where our CTE academies are, if they're functioning, if they will be functioning if we come back to school. Also, I think it was 2 years ago now, we had an audit about our transportation department. And I know that there have been some significant changes, staff-wise and others, and I think it would be helpful for us to kind of know where that is, because, you know, even though we're in this pandemic, even though we're not fully operational, we are operating. Our staff, your staff, are doing things in the interim. I'd also like to get some information about the RFQ with the YMCA and what that is, and you know, how that's going to affect ACES. In closing, I want to thank the voters. Even though my race was decided in March, I was still on the ballot in November, so I appreciate people who still cast that vote for me. I did have an appreciative story, is that while I was in line waiting to vote, there were people around me who said, well, I don't know if I'm going to vote for the bond and the quarter-cent tax. I said, well, let me tell you about it. So it's my understanding from someone else that once I kind of talked to people who, I don't know who all was listening around me, but I think I got us a few more votes in favor of it. So, you know, it does help for us to be out in the community. I want to recognize all of our veterans for Veterans Day, and also wish that everyone has a very, very special Thanksgiving. I hope that people will heed the warnings and perhaps do it through Zoom or FaceTime or Facebook or, you know, virtually, as opposed to going to grandmama's and possibly, you know, causing, you know, some issues in the pandemic. But I think we really need to be grateful as to where we are. And when we look around, even in this room where you are, and see who's there. I mean, there's a good possibility that, you know, one of us could not be here come the New Year, depending on what the circumstances are. So we need to be safe. We need to encourage other people to be safe. That's why I'm very cautious about when I go, where I go, and how I go. And I just, as I've said in most of these meetings since the pandemic started, may God have mercy on us, and hopefully we'll get through this. Thank you.
Thank you, Diane. Is there a motion to adjourn?
So moved.
Is there a second? All those in favor say aye.
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 All right, thank you. Thanks, Jill. Thanks, Lisa. Lisa, here's your...
Thank you so much.
Sure, go ahead.